Okay, hopefully we can continue while that last bit gets worked out. Okay. So members of the public wishing to address the board may indicate their desire to do so during the relevant portion of the agenda. Persons wishing to provide comments on an agendized item should raise their electronic hand in the Zoom platform to address the board when that item is under consideration. Persons wishing to address the board on matters not on the agenda should raise their electronic hand in the Zoom platform during the public comment portion of the agenda. Please be advised that board members cannot respond to comments regarding a non-agendized item. All speakers are requested to state their full name, affiliation with the district, if any, at the beginning of their comments. Board policy ordinarily limits the time devoted to any single agenda topic to 10 minutes, and individual speakers are ordinarily limited to 3 minutes. If the board decides to expand the amount of time to be allocated to a particular agenda item because many speakers wish to address that item, the board may reduce the time allocated to individual speakers to 2 minutes, 90 seconds, or 1 minute as appropriate in order to permit more speakers to comment. The board will announce the amount of time to be allocated to each speaker before public comment on each particular agenda item begins. That also means that the board needs to know all of the speakers who intend to speak to that topic. So we'll ask a couple of times to make sure everybody who does wish to speak has their hands up so that we can make that calculation and hear from those speakers. The time allocated will be displayed on the Zoom screen, and when a speaker's time is expired, mute the speaker. We won't not notify you. We'll ask you to finish your thoughts and conclude. Okay, and Ms. Polito, please tell us about translation.
Buenas noches. Si desea escuchar esta reunión en español, presione el icono de interpretación en la parte inferior de su pantalla. Muchísimas gracias.
Okay, and that moves us on to our roll call for the evening.
Student trustee Stead.
Here.
Trustee Thompson.
He is present.
He is present. Trustee Stevenson.
Here.
Trustee Ginn.
Here.
Vice President Dubois.
Also present, but getting cleaned up.
President Sarver.
Here.
A quorum is present.
Thank you. Okay, that moves us to approval of the agenda. Does anybody wish to move any agenda items or make any changes? And if not, is there a motion of approval? Any motion for the agenda approval?
I'll move to approve the agenda.
Okay. A second?
I'll second.
Okay, all those in favor? Aye. Okay, the agenda is approved. Okay, report out on closed session. And in closed section, we did take one action by a unanimous 5-0 vote. The board voted to approve the settlement agreement in case number 2021-2022-2. And with that, we move along to approval of the consent agenda. The board action to approve the items in the consent agenda is taken simultaneously with one motion, which is not debatable and requires a unanimous roll call for passage. The action indicated on each item is deemed to have been considered in full and action taken as worded therein. Only members of the board and the superintendent may remove items from the consent agenda. Members of the public may provide comments at the start of the consent agenda item, which may convince a board member or the superintendent to remove an item for further discussion. Okay, do we have any public comment about items on the consent agenda? Please raise your Zoom hands if you wish to encourage board members to remove anything for discussion. Seeing no hands go up for that, do any board members have any items that they wish to pull for discussion or not? I will like to hear a motion for
I
approval
move to approve the consent agenda.
I'll second.
and seconded. Okay, with that, can we have a roll call for the consent agenda?
Student trustee Stead,
Yes.
trustee Thompson.
That was a yes vote from
I heard
trustee Thompson.
Trustee Stevenson,
Yes.
trustee Ginn,
Yes.
Vice President Dubois,
Yes.
and President Sarver.
Yes,
Great, motion carried.
excellent. Now, as we gain a little momentum, we'll move on to our special recognitions. Always our favorite part of the agenda.
Yes, absolutely. Good evening, everyone. I am excited to kick off our night with special recognitions by recognizing our outstanding frontline COVID response team, also known as our district health team. Yay! We know that they have been busy working around the clock to outline and implement our COVID health procedures and respond to staff and students' questions and needs. They have been absolutely superb, and we want to recognize their excellence this evening. Our health staff, we have Kristen Coronado, we have Jackie Varias, we have Cassandra Marquez, Tanya Eddington, Claudia Rinden, Samantha Ginger, Nanette Passion, Michelle Murray, and then also Jocelyn Tejeda, and of course, Heidi Flagg. And so we are so excited. And we also would like to give honorable mention to Javier Gutierrez, our wellness and health coordinator. And we will share more outstanding information throughout this evening. But once again, these individuals have gone above and beyond to support our students and to make sure that we have as safe as possible environment under our pandemic. And so with that, I salute you and thank you so much for your service. In addition to our district's health team, we would like to also recognize our maintenance and transportation teams. Both of these departments have been working tirelessly and have gone the extra mile to keep our schools running smoothly and safely. Our bus drivers are the first point of contact for many of our students, the first and last of the day. Our maintenance team makes certain that our facilities are safe so that our teachers can focus on instruction. Both departments are critical to the success of our schools. I would like to thank Associate Superintendent Leach, and also I would ask her to share more words about these two departments.
Thank you, Dr. Williams. So definitely two of my 7 favorite departments for sure. But definitely the biggest punch, the biggest bang for your money you are going to get with our transportation department and our maintenance and operation department. I invited Walter to accept, but he said that I may accept on his behalf. So I said, well, no promises on what I'm going to say. I want to definitely do right by him. Our M&O team, as you know, as I spoke through all last year, just really attacked our HVAC systems and made those ventilation changes and really just embraced this basically just miracle work that they did regarding some of our older units. And they really came together and learned a lot about our systems and what the district needs moving forward. So big lift, congratulations to all of them, all of our custodial team, all of our trades individuals as well, everyone just on the M&O side. We are so grateful for you. We are so grateful to Darrell and his team as well, all of our bus drivers. Thank you for being those smiley faces in the morning, and thank you for being those smiley faces in the afternoon, keeping our kiddos safe to and from school, especially when they're, on a bus, and keeping those safety protocols in check. So thank you again. Thank you, board. Thank you, Superintendent Williams, for honoring these two fabulous departments.
Thank you. Thank you.
I'd also like to echo that thanks. Really, you talk about essential workers, and everyone in education is an essential worker. But these are the people who have been there throughout the pandemic, being on the front lines, making sure that the safety was there for everybody else to be able to come in and do the work, for the students to come in and do the learning. And Walter is kind of playing close to form by not choosing to do the acceptance and say a few words. But Walter has stepped out of character a couple of times over this past year, times when I've encountered him in a parking lot somewhere. And he's pulled me aside and he said, the leadership of this district needs to recognize the extraordinary people and the extraordinary work that has been done on the operations side to get these schools ready and safe for everybody else to come in. Being there in the midst of all of the danger, doing the hard work over all of these months. And we couldn't be here without the efforts of both of these groups that was recognized tonight. I don't want to underplay the huge amount of work and sacrifice and quality that everybody in the district has delivered, but this is our rock solid foundation for being here. Thank you. Thank you. Now let's move on to another of my favorite parts of the evening, student trustee comments. Student trustee Steed.
Thank you. So I'd like to start by saying that the smoke and heat is a massive problem on all campuses now. Teachers are told to keep their doors and windows open for ventilation, but smoke and heat makes this almost unbearable to be in the classroom and certainly keeps both students and teachers from being their best. And the board should start looking into long-term and short-term solutions for this problem, whether that be portable fans or all the way up to an AC revamp. The problem of smoke and heat is the new normal for the fall quarter and will continue only to get worse as years go by. And furthermore, as the fires continue, it's also time to start planning for what the protocol is when the AQI gets too high to safely have school and how individual sites should deal with it. In other news, I applaud the district for making a COVID dashboard showing how many cases are at each site at the end of the week. But I would say it's crucial that communities trust this data. And right now, many communities and many students and teachers do not think it's accurate, which I think is a massive problem. Thank you.
Thank you. And I think we'll have some chance to talk about both of those topics as the evening goes on. Let's move to comments from SDTA and Ask Me. And it's been a 3-week break. I think I've lost track a little bit, but I'm going to go with SDTA and Edith first this evening.
Thank you, President Sarver. It's actually Leanne Strube speaking for Ms. Salvatore in her absence. And officially, I'm speaking to you as the SDTA secretary and a member of the executive board. However, I'm going to echo what Ms. Stid just said, because I'm also speaking to you as a full-time teacher with more than 150 young people sitting in my non-air conditioned classroom every day. The last 2 days have been very hot, but the conditions in my room this week were not as bad as they were on Friday, August 27th, when the AQI peaked and I decided to shut the windows and doors to let the air purifier do its work. Teachers at other sites reported indoor temperatures as high as 88 that day, and the same conundrum. Close up to keep the smoke out, raising the indoor temperature and possibly increasing the risk of COVID exposure, or allow smoke-filled air to permeate our students' lungs. Neither choice was a good one. The takeaway was a need for fully air-conditioned classrooms with HEPA filters across the district. It is time for the district to modernize its facilities, not just to add new buildings, but to renovate or even replace the 70-year-old classroom wings at Woodside, MA, and Carlmont, while adding air conditioning to the historic buildings at Sequoia in the least intrusive and most cost-effective way possible. I am bringing this urgent need to you, the board, because the only way to transform our school sites is to put a bond measure before the voters. Our district has not gone to the electorate for a bond measure since June 2014, when the voters passed Measure A, enabling us to build incredible new science and technology facilities across the district, and to construct the facility that would become Tide Academy. SDTA believes it is time to bring the best facilities to all disciplines and all students. Upgrading our facilities to ensure all classrooms have adequate ventilation and air conditioning would signal to our families and our community that we care about every student's well-being. The other urgent issue for our district is the acute shortage of paraprofessionals and substitutes. As teachers follow district protocols and stay home to await results of COVID tests, sites are unable to find enough substitutes to cover their classrooms. Administrators are subbing sometimes 2 or 3 periods in a day, pulling them away from the crucial day-to-day running of our schools. Fellow teachers are being asked to cover during their prep periods, reducing the amount of time to plan curriculum and grade student work. And the shortage of paraprofessionals means our neediest students may not be receiving the services the law guarantees. Again, the board has a role to play in solving our staffing crunch. Please empower our HR department to create incentives to bring on more substitutes and paraprofessionals so that we can maintain a healthy, safe environment for our students. In her communications with district employees, Dr. Williams has emphasized repeatedly that we are a team with all of us, teachers, classified staff, and administrators, dedicated to achieving excellence for our students. We look to the board to provide the foundation for excellence through improved facilities and full staffing. Thank you.
Thank you. And I believe there are 2 points there that are also going to be part of our conversations as the evening goes along. And I thank you for that in perspective to get us going. Let's hear now from Ask Me and Grace Horton.
Good evening, everyone. Thank you, labor partner, for advocating for classified staff. I appreciate that. It's always nice to stick together. Am I coming through okay? I saw an unstable signal.
Yeah, Grace, I think you might try shutting down the video and see if the audio has more bandwidth to work smoothly.
Can you hear me?
Sounds good.
I definitely go for that. Okay, super. So I had started by thanking our sister union for advocating for the classified members so much, Ms. Strube. And as I was putting together my AFSCME report, there's some items here that may sound repeated. And I guess we were on the same wavelength here as we were preparing our reports. First of all, staffing again. Food service is in a dire need of staffing. We don't have the supervisor, we don't have a director, but most of all, I have checked with every site, and every site is missing 3 to 4 personnel. And it is just crazy to be at a school site in those long lines with food service trying to be delivered or served to students when it is a huge disarray. I keep hearing from the kitchen, and it is the same. It is the same. It is the same. You know, they are down people. They need people. So just like Ms. Stroop says, let's empower HR, open up those positions, make sure that we're reaching out, communicating that we need our kitchen staff to be fully staffed in order to bring the services that feed our students on campus. My other item that I wanted to report on was development. So there was little birdie that reached out to me, and we are going to have paid professional development for our paras and IAs. That has been a long time waiting, and we're so happy that the district has made its way to offer that. We have been asking for that to no avail. And again, I just want to say, hurrah, hurrah. They have actually hit the line with bringing those classifications on. I'm so glad the district was able to see the need to be able to be in alignment with the parents and the teachers to support the students after them being gone for a whole year, and bring them back, bringing students back, and wanting to make sure that we are all prepared. So again, thank you, thank you. There is a Bosco catalog that was sent out with a list of training opportunities for classified staff. However, what is missing is how do we register and who pays for it? So it would be nice to get the rest of that information so that way classified staff that are not part of the what if a carpenter wants to be an accountant, right? How do we support that person? What if a kitchen worker wants to be a counselor? You know, how do we support that person? And so OSCO has like this amazing list of resources. We just, again, don't know how to register, and we don't know who will pay for that. So that information is needed. So along with planning, AFSCME is again asking to be on the calendar committee because PD lands on unpaid days for some of our classifications. So as a team member, as we work together in partnership, AFSCME is a stakeholder and would like to continue to work in collaboration with the district. Speaking of those collaboration and stakeholder and partnership, I did peek at the COVID-19 presentation, and I do see that Worksite, the district has brought on Worksite Labs. However, AFSCME was not invited. We have no idea who Worksite Labs is, what they do. So basically it was not vetted. So again, we're missing AFSCME when the district is working in collaboration with who? We're missing. Please include AFSCME. And just two more items here. It has been a struggle to get on the superintendent's calendar. She's a busy lady. I'm well aware of that. We connected, but it wasn't really something of quality. You know, AFSCME would like to get on the calendar with Dr. Williams, and we'd also like to get on the calendar for HR. We have a lot of, well, not a lot, but we have some items that are really on the front burners. We really need to sit with someone to discuss and work through these items. I don't know what else to do. I don't know how else to ask for that. So again, we're stakeholders. We would like to continue to work in collaboration with the district and have a seat at the table with you all. That is the AFSCME report. Thank you for your time.
Okay, thank you for that. Okay, this brings us to
President Sarver. President Sarver, this is Grace.
Yes.
I signed off too early. I'm so sorry. I also wanted to recognize the health team. Working at a site, I can't tell you how impacted that they have been. It has been all hands on deck. Literally, more hands are needed to be able to connect with families. This work has been, there's additional work that has been added that has been unforeseen. And so many of the offices are putting aside their daily tasks, their daily duties, just to be able to assist with making phone calls, connecting with parents, and doing that person-to-person connection with families when students are calling in sick, because you really just can't call out sick. What do you mean by sick? So we have to call and have a conversation with families and find out what kind of sick are you? And then on those other questions. So a huge, huge thanks to the whole health team. They have been amazing, and they have been bent in so many different forms. And so again, a big thank you. Now I'm signing off.
Okay, thank you. Okay, on to our correspondence for the evening. And have a list of the 10 correspondents from whom we received something since the last board meeting. And I've broken it into items for general public comment and other items that we will review as we get to the COVID update section. So in public comment, traffic conditions around Sequoia High School and nearby Redwood City schools are unsafe for students walking or rolling to and from school. Sequoia representatives are invited to join the Redwood City Together Safe Routes to School Committee in researching issues and solutions. Another correspondent writes that the SRI site across from MA High School is being sold, which represents a once-in-a-lifetime opportunity for Sequoia to help MA acquire access to additional sports fields. There was a request to please report detailed data on how students have scored on AP exams over the past 5 years. For example, number of test subjects each year, test scores by test subject, by year, and by school. I know a lot of that information is in the district's data dashboard. Fall and spring heat makes many classrooms across the district extremely uncomfortable, and circumstances are further complicated by COVID regulations and smoke from wildfires. Providing effective air conditioning for every working space on all Sequoia District sites is a critical need. Please enact a bond measure in the upcoming election year in order to meet this need. And finally, due to a lack of funding, Star Vista is closing the Your House South program at the end of September. This is a critical resource for homeless, runaway, and abused teens. San Mateo County agencies should do something to keep this program in existence. It will return to the other correspondence when we get to the update. And this moves us along to public comment. period for speakers wishing to address the board on matters not on the agenda. Persons wishing to provide those comments on non-agendized items should raise their electronic hand in the Zoom platform so that we can determine how many speakers we have and determine whether we need to change the amount of time from 10 minutes and 3 minutes per speaker. So if you do have a comment for this, please raise your Zoom hand and we will hear public comment. All right, so among our 25 attendees, I am not seeing hands go up. And perhaps we will get more during the COVID-19 update. With that, seeing no hands up, let us move on to information items and have our COVID-19 update. Superintendent, please take it away.
Thank you, President Sarver, and thank you, Board of Trustees. Our health team, as mentioned earlier, they have been working tremendously hard to ensure the safety and also the health of all of our staff and students. They've taken measures, they've worked over and above our expectations and case investigation, contact tracing, also with developing and releasing the new COVID-19 dashboard. We are constantly working based on our feedback to update our protocols, and also we are listening to feedback in terms of the need for more hands on deck to support our health team. We realize that it is taking a tremendous amount of time in order to go through these protocols and processes. And we also extend a level of understanding as well to our staff, as we know this is our first year back to in-person instruction. And we know that these protocols are new, and we just, again, commend our team. Today's presentation, you will hear more about recent updates, also about our partnership with Worksite Labs, who will be able to provide additional testing support and contact tracing. And so I'm going to turn it over to our two gentlemen who have been working very, very connectedly with our community and also with our staff to ensure that we have proper protocols in place. And that is Jarrett Dooley and Javier Gutierrez.
All right, thank you, Superintendent Dr. Williams. Let me get our screen share going. All right, can someone give me a thumbs up if we can see our slide presentation? All right, it completely disappeared. Thank you. All right, again, thank you, Superintendent Dr. Williams, President Sarver, trustees of the board. We are here tonight, as Dr. Williams alluded to, giving an update on COVID-19, our protocols, guidance testing, and some exciting new information from our newest partners, Worksite Labs. Before we jump in, we certainly want to just continue to reiterate at every opportunity that health and safety is our utmost and top priority as we welcomed our students and staff back to our schools for the 21-22 school year. Following measures and protocols we have implemented to ensure safety for all of our students and staff, which include student and staff mask requirements indoors, reinforcing the importance of hand washing and respiratory etiquette, cleaning with EPA-approved products designed to combat COVID-19, maintaining healthy facilities and improving ventilation, guidance and collaboration with local and state health departments, as well as our San Mateo County Office of Education, implementing contact tracing, isolation, quarantine, and notification protocols, testing, which includes post-exposure for staff, soon on the horizon, very, very soon, diagnostic testing for our students and staff, as we will hear more about this evening from our partners from Worksite Labs. And a real thorough reminder here, an emphatic reminder, anyone that is symptomatic, students and staff, please remain off-site, notify the school, get care, and please test for all health and safety of our students and staff. Additionally, at the bottom of the screen, you can see clickable links for our established guidance that we follow in developing our health and safety measures and COVID protocols. As you can see, the first link is our fall opening school plan that has been shared out by Superintendent Dr. Williams, as well as our guiding document, the San Mateo County Office of Education's Pandemic Recovery Framework, which is referenced throughout almost everything that we publish as far as guidance on COVID-19 related procedures and policies. An additional link there is brand new guidance that came out from the California Department of Public Health, which is specific for schools. And of note, we do want to point out, again, reiterating staying home when you are sick and testing when you are sick. Again, we cannot emphasize that enough. Additionally, we have worked from that guidance on the development of visitor and volunteer processes and protocols, as well as the state does classify some of those individuals as workers. And so there will be falling into our vaccinated requirement category, which is on the horizon on October 15th, which we are working towards process for collecting staff vaccination status, and those that are not vaccinated will be required under that new order from the state to test weekly. Additionally, from that guidance is of note, school-based extracurricular activities. There's some information that is very specific to activities occurring indoors. Athletics, some of those activities fall into this category, as well as band and choir. Guidance currently says if any of those activities cannot be done outdoors, or we cannot do indoors with the correct social distancing and the correct masks and or face coverings, because there are specifically recommended face covers for band and specifically some of the wind instruments, that if we can't meet those requirements, then we should be testing all of those students twice weekly as well. And as we'll hear more about, we will have those plans in place prior to those requirements being implemented. And so we will be meeting those requirements of that updated guidance very shortly. I'm going to go ahead and turn it over to Javier Gutierrez, our wellness coordinator.
Good evening, everyone. I want to, in addition to what Jared just shared and what we're looking forward to hearing from our partner, we wanted to let everyone know we did provide, in the spirit of providing more information and more transparency into our protocols and our process, we did update that fall opening school plan with additional information, including what is on this slide, the 9 steps. That is our process and protocol whenever we have a positive COVID-19 case on campus. This outlines our entire process from the time a potential case is reported to the health team. When that happens, we follow up and confirm that it is actually a case. Sometimes there's potential cases or some exposure that are reported or symptoms, but it's not always an actual positive case. So that happens through the case investigation process. That's where we gather initial information, confirm the details of the potential case, and then identify and determine with San Mateo County Health if it is an actual positive case. From there, we have contact tracing. That's the process where we determine who else may have been exposed, who may be at greater risk, or who may actually be a close contact. Anytime we do have a positive case on campus, we provide the appropriate communication to all identified contacts or potential exposures. We outline the different communications there, including the close contact communication is usually personal communication, either via phone or email, to also inform that person of their next steps. But we have some more general notifications. The general exposure notice goes to anyone who is not identified as a close contact, but may have been in the same area, for example, a classroom or an activity, or for example, our district bus as well. These people receive a general exposure notice just to let them know that while they are not a close contact, they were in an environment for greater risk. And then we have the AB 685 notice, which is required that we send to all staff on campus that are on the site at the same time as a positive case. So this doesn't mean every positive case requires an AB 685 notice, just those that were on campus. And we let our staff who were also on campus during the infectious period of that case, we let them know that there was a positive case on the premises. That could be even if they're on opposite ends of the campus. That is something that we are required to do by Cal OSHA, and I know that our employees appreciate that. We follow all internal reporting and the required reporting to the local health department. We collaborate with San Mateo County Health and San Mateo County Office of Education on every case. And we are required to report to our local health department. That is a state of California requirement. Finally, we want to make sure that the site is cleaned. As Jarrett mentioned earlier, we are using Environmental Protection Agency approved cleaning products, and we want to make sure that any area where there was a positive case is thoroughly cleaned and disinfected. Really important is that red text at the bottom to please note, please note that each case is unique. Each response is determined in consultation and collaboration with San Mateo County Health. And there are times where additional measures may be taken. This depends on the location of exposures, the nature of exposures, whether people were masked or not. And those different factors determine what the response will be, or what type of quarantine people may be eligible for, whether they have to do a full quarantine, whether they can do a modified quarantine or a shortened quarantine. This is because sometimes, even though we have a defined process, and the next slide will also show part of those outcomes, sometimes there are certain situations or peculiar details that are beyond the defined parameters here and on the next slide that we're going to see. But hold on a sec. Sorry, my computer was trying to kick me off. Not right now. We're talking important stuff. So as was mentioned earlier, our COVID-19 dashboard, we're very proud to have that. And that was in response to listening to you all, listening to our community, wanting to know, what are the actual cases, and do we, how much do we need to worry? So we have that COVID-19 dashboard up, and I want to clarify that that is all the positive cases that are reported to our district. There could be more that just aren't reported to us, or that people may not even know that they are positive. And there may be other cases where that information doesn't result in a positive case. So, or that case was not on campus, but we still count it. So every confirmed positive case in our district is on that dashboard, but also don't want everyone to worry, because it doesn't mean that all of those cases were actually on campus. Fortunately, we do have people that stay home when they start to feel symptoms, or for example, the first week of school, there were students that never reported to school because they were in isolation or quarantine. And so while they are counted on our dashboard because we do have a confirmed positive case in our district, those cases were never actually on campus. So know and be confident that a lot of those cases were not actually on site, although we do have cases that have been on site, and that's where the appropriate communication is provided. Next slide, please. This is our COVID-19 exposure at school flowchart. This is just one element in the pandemic recovery framework, which was linked in the previous slide. This is the guidance that we follow from the San Mateo County Office of Education. This is also provided in our fall opening school plan. We did take out some elements of it without trying to recreate a 26-page document to make it simpler for all of you. And this is an important element that's in there. We follow this, but we also review every case with the San Mateo County Health Department. This does hold true for most, but as we mentioned earlier, There may be some peculiar details or circumstances during the potential exposure that may require us to stray from this in consultation with San Mateo County Health. Maybe even though there is an unvaccinated, asymptomatic, close contact that was wearing a mask, there may be another factor that would not make them eligible for the modified quarantine or require them to refrain from certain activities. But be confident that we are following the guidance. We collaborate with San Mateo County Health on every case that can impact your school, your students, or your family. And we're working really hard to keep on this. And we have an exciting partnership to take this to another level. And there, a lot of this process that we've outlined, starting with the testing that Jarrett pointed out, we're going to be needing more of. And we look forward to providing more of it to our staff and students, to the contact tracing and communication. We're really excited that Worksite Labs is going to partner with us, that we're going to have additional support for our staff. As was also mentioned earlier, our health staff want to appreciate and acknowledge them again. As was pointed out, they have been working really hard, and we have been overwhelmed, but we're keeping up on it and doing the best we can. But help is on the way, and that's from Worksite Labs. So I would like to introduce Gary Frazier, who is a CEO of Worksite Labs, and his team.
Thank you, Javier. So I'll just start with a brief intro, and then I'll hand it off to the smarter people on my team, Dr. Williams and James. But so Worksite Labs, we were founded last May, actually, by a team of nurses, physicians, and hospital administrators, primarily from California and a couple from the DC area, but primarily from California, specifically to address what was an unconventional situation, because this being a once in a lifetime pandemic, really. And what that was the fact that the traditional laboratory space and even the healthcare space weren't set up properly to address some of these unique needs. And so we formed Worksite Labs so that we could be nimble, so that we could be fast, and so that we could fit into the areas. And we called it Worksite because at the time there was Smithfield Foods, there were all these workplaces that were having outbreaks. And we said, we're going to put a lab at the worksite. And these are going to be high complexity CLIA licensed labs per the federal government and the state of California. And that way we can turn around the highest quality PCR tests in the shortest amount of time, and the client, whoever they may be, will not fall behind a queue because we have a gazillion clients and we're doing 400 different types of diagnostic tests. We were just focused on COVID. And our first client was LA County Sheriff's Department, Correctional Health Services, specifically testing the most vulnerable detainees that were coming through to a tick of about 200 to 300 a day. And that was last summer. And we continued to roll up, where we ended up with other interesting types of customers that had unique needs, like Hawaiian Airlines in the state of Hawaii, when just before they reopened last October, and the Big West Conference. So those are Cal State Fullerton, UC Davis, and a number of other schools that were playing sports last year during the pandemic and through this past spring. And all of those are unique because they did not meet the traditional criteria of being a hospital or a health clinic, and they too had needs. So that's how Worksite Labs was created. And now, as the pandemic has continued to morph, and I guess the technical term is mutate, we have continued to evolve. And we've evolved from being a testing company to a full-blown laboratory company. We're at 19 major cities across the United States. Again, most of those being the West Coast, from Washington, Oregon, California, Northern and Southern, Arizona, and Nevada. And then we go east from there into Texas and New York and other places. And we've moved from just testing to contact tracing, to other technologies that are more, I'll say, consumer centric and user friendly for your types of needs that don't fall neatly into a healthcare kind of go see your doctor first environment where you need answers, you need them fast, you need reporting, you need that fast, and you need to be able to probably be proactive even in being able to identify people that may or may not have even reported that they have COVID. So I'm going to be quiet because there's a real prescriptive proposal that has been accepted that our team has put together for tackling and essentially augmenting what you guys are already doing, because that's kind of where all of this came from, is the regular systems were having a tough time and we're being overwhelmed, and our ability to set up operations in any regard, testing, tracing, or anything else within 30 days or less has been our calling card in order to assist and augment your work. So that's the intro. I'll let Lindsay and others, and I think I said a lot of the stuff that's on this slide, by the way. So Lindsay and others, Dr. Lindsay Williams, I just call her Lindsay, but Dr. Williams, you can jump in.
So hi, everyone. Good evening, and thank you so much for having us. So as Gary mentioned, I'm Dr. Lindsay Williams. I'm the Chief Clinical Officer for Worksite Labs. Just very quick, important note. So I'm Dr. Lindsay Williams, no relation to Dr. Darnice Williams. Just so happens we have the same last name, but no relation there. So again, thank you so much for having us today. And just to elaborate a little bit on what Gary mentioned, this is just a little bit more, again, about what we do. And how we bring the laboratory testing services to the clients that need them. So a few things that I'll pull out here of this slide. So first of all, the type of testing that we do. So we have the gold standard PCR testing methodology, which has 99% accuracy. We do have 2 laboratories in the Bay Area. So we are poised and prepared to serve the need for your schools, for your students, for your staff and their families. And again, we are using the gold standard laboratory testing that is the highest quality and highest accuracy. As Gary mentioned, we're an international and domestic trusted travel partner with other different local and other statewide organizations such as the state of Hawaii. And then we have something else I'll call out too. We as Worksite Labs own every part of the process. So I'm not sure, I feel like we all have different testing stories from the beginning of COVID till now, but we as Worksite Labs own all parts of the process. We own the front end of the collections, we own the laboratory, and we own the resulting. So we own all pieces of that process, which makes it so we can have a boutique style of service, and we can have a lot more guarantees around our turnaround time, a lot more tightness in our operations because we own all parts. We do not outsource any part of that process. And so then we can move on to the next slide. Okay, so just a little bit about our COVID testing services, and I'll kind of go clockwise here. So starting with the on-site testing, and the plan here that's kind of laid out is basically taking that proposal and summarizing it, right? So this was discussed with Javier and Jared, and working in close collaboration with the Sequoia team. So from Monday through Friday, in the services at the schools will be from 9:30 to 5:30. So that way we can stay open a little bit later, again, to serve students, serve staff and their families. We'll have a rotating coverage, schedule for coverage at all schools. And so it'll kind of be staggered where we'll have Monday, Thursday at certain schools, and then we'll have a rotating schedule on Wednesday. We can get a little bit more further into that if there's questions, but just kind of keep it at high level. So we have the locations listed here as Woodside, Menlo, Atherton, Sequoia, and Carlmont. And actually just this week, we modified that plan to include, now, excuse me, I'm gonna look at my notes here, to include Tide, to include, oh, excuse me, I'm blanking on the names, to include the other school, the Tide, EPAA, Mills, I believe one other location. So basically, we'll have all of your locations covered with testing services, in the course of a given week or a given month. For the PCR tests, we are doing mid-turbinate nasal swabs. So this is not this quote unquote scratch your brain test. These are not the deep, very invasive, uncomfortable tests. We're doing a self-collected mid-turbinate swab. So our staff actually walks the individual in the collection of their own swab. And we find that method, they feel more ownership over the process. They feel a lot more excited about doing it, knowing that we're not, again, scratching their brains, quote unquote. So we walk them through it, and we've had a lot of success doing the swabs in that way. And as I mentioned previously, we are using FDA and EUA approved PCR assays to run all those samples. So for our reporting results, we have a 12 to 24-hour turnaround. And that reporting result is through a secure HIPAA compliant portal. And that would be for designated school personnel, and then also to the patient, to the parent or guardian, whomever is designated as the person to receive the notification will ultimately receive the notification. And we are working, of course, in collaboration with the local agencies, such as CalReady and the county, to do reporting. So as the CLIA laboratory, we are also doing the appropriate reporting to the state and other regulatory bodies. Last but not least here is the billing piece. So this is being offered free for students, for staff, for their families. There is a one-time collection of insurance information, and this is per a state Medi-Cal requirement. So the person should not receive a bill in the mail. This is just literally just from ACA kind of Medi-Cal requirements in order to be able to bill the federal government for these tests. And so
let me elaborate on that, just because I know, so for Medi-Cal specifically, we are required to collect all personal information. If there is someone that is undocumented or say homeless, we're also required to collect their information. It has nothing to do with whether we're going to bill their insurance or not. It's about consistency. And what the government doesn't want us to do is to treat or appear to treat one group of people different than another group. And so therefore, to basically fix all that, we're asking for everyone's insurance information, no matter what their status is. Ultimately, there is no out-of-pocket for the individual. And by federal rule and state rule, their insurance is not to ever bill them on what's called a balance bill or bill them later. So just wanted to be clear on that people will be asked for this information, but it does not indicate that they will themselves receive any bill or anything else. So just want to put that out there because I know that often comes up.
Okay, and then we can go to the next slide. We can have James take on this section. He can introduce himself.
Hi there, everyone. James from Worksite Labs. I'm the Chief Experience Officer. Work very closely with Dr. Williams at Worksite Labs over on the clinical team and with Gary helping get these programs set up. So I'm going to be running through the contact tracing portion of what we had proposed. So as we've been putting this program together, working very closely with Jared and Javier, they have provided a lot of insight in terms of what the protocols look like in terms of what SMCOE is doing with their pandemic recovery framework. So we're going to be following that protocol very closely. Going to be conducting those calls really built around that protocol. And it was what Jared was sharing earlier in terms of the different steps of the process. So they provided a great outline for us to be able to put together a very clear training protocol for our staff in terms of what that outreach is going to look like. The other piece of that is we really do want to be doing this in collaboration with the school staff. We think it's very important because the trust does lie with the existing staff, very familiar names, familiar faces. So we really want to be able to collaborate closely and continue to move forward with that program, but really provide the support that we were hearing about a little bit earlier. In terms of providing coverage, our initial proposal is for 5 full-time employees at launch, looking to scale to a pool of potentially 15 full-time employees. All of these employees are going to be Johns Hopkins contact tracing certified. They'll also be going through HIPAA, FERPA, and CMIA certifications also on the back end. And the way that we came to these numbers was the assumptions of about 8 to 12 calls per day per full-time employee, knowing that these caseloads can shift kind of depending on if there is an active outbreak, how many positive cases you're getting. So we have the flexibility there in terms of scaling up or needing to scale back to provide the appropriate kind of coverage. In terms of case management, we really were talking it through and trying to figure out the best way to really hone in on the information that we needed. So we're really going to be tracking exposures based on different class layouts and just patterns of close contact as they're going to be moving throughout, as students or faculty or staff are moving throughout the different campuses and schools. And our goal is to be reporting to a shared portal for the outbreak tracking, so the SPOT system. So continuing to move forward with getting integrated with that system and moving away from a more manual process that's currently in place. Gary, I don't know if you want to speak to the advisory services.
Yeah, yes, I could do that. But one point I wanted to make, just back on the contact tracing, is that another, I guess, bit of context here is that we are also contracting with the San Mateo County Office of Education to specifically just do contact tracing. So no testing, specifically just the contact tracing piece for all of the schools. It'll be offered. So just wanted to provide that context because I'm pretty sure you guys are within that Office of Education's jurisdiction. And so the advisory services are really so that we are available to the leadership of the so many Sands and Sequoias. So my apologies, but the Sequoia Union High School District. So when, these things are constantly changing, as you already know. Each mutation, each district, each jurisdiction, from the CDC to the county to the state to the federal government. And as these things changes, we want to be able to keep you up to speed. We want to be able to provide gap analysis and look at your classrooms and your general layouts. And if there's anything that we feel just from our expertise can be done better or modified, we will be offering that as well. So that's just this is really an all-inclusive type of offering. So this would include that as well. I'm not sure if I helped it, but the advisory services are really quite general in nature, but specific to COVID in terms of things changing. I think that's it.
Great, thank you, Gary. In wrapping up tonight's presentation, we wanted to just make a reminder of all of our vital, well, not all, but a bulleted list of some of our vital resources for our students across our district, which includes our on-site staff, our counselors, mental health support specialists, our other site and district-wide partners, as well as some additional resources related to social emotional learning, collection of data for our students and staff in some of the areas to include self-awareness, social awareness, self-management, decision-making, etc. We will continue our social emotional learning task force, that group's development of an implementation plan, which includes some social emotional learning pilots, hopefully happening throughout this year, as well as the social emotional learning trauma-informed community resiliency model training for our staff, as well as a collaboration with the Parent Education Series and having some of those sessions for our parents in the evening across our school sites over the year. And then community partners and our mental health, those partners, tiered intervention supports and additional resources. And then a link at the bottom there with further resources on our district website under health and wellness. And that concludes our COVID-19 update. Thank you to Worksite Labs staff for joining us this evening, and thank you for allowing us all to provide this update.
Thank you, team. And that concludes our presentation.
Thank you. So with that, I'd like to bring our conversation into a couple of steps. I would like to share the correspondence that came in on this topic area, and then see how many public speakers we have to hear from them, and then have the board go into their discussion. So with that, let me cut to the correspondence. And we had 4 pieces of correspondence that related to this. One was a request to please mandate vaccines for students as soon as possible. Other districts around California are starting to do this. Detailed sharing of Sequoia District COVID-19 safety protocols has been slow and reporting of detected cases has been vague. And I think we've been addressing that already. Please enable COVID testing on demand as often as anyone wants and available immediately. And then please mandate that masks must be worn outdoors at school as well as indoors. Other districts have done this. All right, from public comment, I currently see one panelist hand and one attendee hand up. If there's any other comment, please raise your hand so we can determine if we need to adjust the timing. I now see 2 attendee hands. Okay, last call, and otherwise we'll hear from those 3. All right, so we will go ahead with our normal 3-minute timer to hear from Abby Corman, Ellen Jacobson, and Strub and Isabel Steed.
Hi, my name's Abby Corman. I'm a teacher at Menlo Atherton. I'm really excited to hear that we've partnered with Worksite Labs, since this sounds like it's going to be really effective for both testing and contact tracing. I didn't hear a timeline though, and maybe I just missed it, of when that starts. So that's my first biggest question. And then my second question actually is to Jarrett around that last slide around vital resources for SUHSD students. I'm excited about all that's on there, and I'm wondering when those things will be on the agenda so that we can actually hear what those things entail. Thanks so much.
Okay, and we're taking notes. We'll come back to these things after we've heard from our speakers. We'll hear from Ellen Jacobson next.
Hi, I'm Ellen Jacobson. I'm a teacher also at Menlo Atherton High School. And actually, my question is very simple. I want to ask Worksite Labs. I didn't hear this. What's the turnaround with the results? Because as teachers get tested, we don't necessarily want to have to miss a day of school waiting for the results. And that becomes a time of, anxiety. What do we do? Do we need sub-plans or what? So I didn't hear a time frame in results, in how quickly results come back. So that's my only question. So thank you.
And we'll continue to take that input and then come back to all these. I think everybody's taking notes on it. Among our panelists, let's hear from Leanne Strub.
Thank you. I think I am repeating what Abby asked. I'm concerned about when this is up and running. Dr. Lindsay Williams said that you can get a whole Worksite Lab set up within 30 days. And since I don't know when this contract was signed, we have teachers who are feeling rather alarmed with the inability to know whether they are testing positive or negative, as Ms. Jacobson just said. So the sooner that, your services sound fantastic. And so the sooner that we can know that we have that support, the better. And I hope it is going to be very soon. Thank you.
Okay, and finally, Isabel.
Yeah, so I was just wondering, what is the general protocol for students who don't have health insurance? So is that just being billed straight to Medi-Cal? And then also someone asked the turnaround time, and I think that they mentioned it, that the turnaround time was for test results was 12 to 24 hours.
Okay, is it the will of the board that we go ahead and have those very specific questions answered before the board goes on? Those are a great bunch of questions. And I believe Mr. Frazier and your team were paying attention to that, and so everybody taking some notes.
Jared and Lindsay, I think, can handle each one of those.
Yeah,
Yes,
sure.
Yes, sorry, Jared, go ahead. I didn't know when to start.
Sure, no worries. I'll jump in real quick. just in full transparency, we've had multiple meetings, phone calls, Zooms in a very short, 2 weeks, I believe. So this is a rushed yet paying attention to every detailed, right? This is our process, and we have done site visits twice. So we, as well as the Worksite Labs team, are pressing. We hear you. We have heard the need and the angst and the anxiety and everything that comes along with where you may be at in your own individual COVID process. We certainly understand. And so we are doing everything we can, and we'll continue doing everything we can to have our testing set up starting on Monday, September 20th. We've worked backwards from that, and that's, I just said it publicly. I'm not sure if I was supposed to, but we're moving. So it's now public. And that's very close. It's not very far away. However, we feel very, very good about where we are currently at. This was a huge step in bringing this information to the board as well as to the public for input. And so we appreciate those questions. Additionally, some of the guidance that I referenced from the CDPH has very specific testing requirements to be in place by September 27th for some of those activities that we cannot have happen outdoors or with the proper face coverings and masks. And so we will also be able to meet those requirements as we will have testing in place on the 20th. I believe it was Ms. Corman's questions on our vital resources. A number of those activities are already underway and in process. We have already collected social emotional learning survey data from a significant percentage of our student population in the spring that we are translating into our MTSS data system as we presented at, was it the previous board meeting or 2 board meetings ago in our MTSS presentation. So we are working on revisiting our MTSS district as well as site leadership teams to coordinate some of that data and also get another snapshot of current SEL data now that our students are back. So more information coming on that to our sites. Our task force, we are finalizing with our assistant superintendent of our team to select dates and restart that task force, as well as the SEL pilots that we referenced as well at some of the small school sites that hopefully will occur throughout this school year. And then the Trauma-Informed Community Resiliency Model, that's CRIM is our acronym that we use for that. That is underway and in process and will be in process, as that's a train the trainer model. We have our MTSS coordinator, Shana Karashima, who is a certified CRIM trainer, and she is training a number of staff as well as the coming Monday, a huge percentage of certificated and classified staff members. So a lot of that is underway and happening.
And 12 to 24 is the correct answer on the turnaround times. And we can guarantee those. I think the other add, and I'm sure Dr. Williams was going to say this, is that the benefit of us already having really strong presence in the Bay Area, when your team came to us, we were really confident about our ability to be able to customize sites, collection sites is what we call them, at your high schools, and to be able to support you, just because, as Dr. Williams, Dr. Lindsay Williams said, we have 2 laboratories in the Bay Area alone, one in Walnut Creek and another one, actually a mobile one, a real brick and mortar one in Walnut Creek, and a mobile laboratory at SFO for travel. And so we have capacity, we have staff, we have other collection sites in and around the area. So it really shortened the lead time to do this. The Medi-Cal question that I forget who asked it. So you're right. I'll say minors 18 and younger or under 18 are all eligible for Medicaid of some kind. That being said, that's the first place in our back office that we go for reimbursement. But should that fail for any reason, Then there is always HRSA, which is HRSA. And then, of course, there's the CARES Act, which is federal dollars as well. So we have no worries or concerns when it comes to the uninsured, especially minors, especially because the one thing that the country does well and the state of California does well is to cover children. So.
Thank you for that. Okay, board member questions and comments. All right, Shawnice.
Thank you for the report today. Thank you, Jared. I'm so excited to hear about talking the interconnection between COVID and cell and social emotional learning. I'm sorry, mental health and all that. So I'm excited about that. I did have a couple of questions. One of them was around staffing. I think you answered it. You're providing your own staffing. And given kind of our climate, a lot of people are having a hard time hiring. I want to be clear, do you guys have enough staff to do this?
Yes, we do.
Yeah.
All right.
Yes.
Spanish and English, possibly?
Yes, we're prepared
Okay.
for that.
All right. Next thing is thinking about, okay, so let me go back. Jared, my question is, now that they have staffing for this, will that relieve some of our staff at our sites? Because even before the presentation today, I know the kind of email I'm getting. I know I work at a school and the type of energy it's taking to deal with the contact tracing, making sure, you know, we being kind and gentle and people aren't just receiving just an email. And I've, you know, just wondering.
Yes, 100%. And we recognized, I believe, the third day of school and then came up with a quick plan, you know, with approval to try and go find our own staff. And we quickly realized there's not many people out there that want to do this work to absorb and you know, provide some sort of relief. And so this is the culmination, if you will, in a very short amount of time. The work that we really do feel, I don't know if you saw all the head nods, but yes, we all feel really confident. And they actually, Dr. Williams and one of their other staff members, Brittany, got to meet with our health staff yesterday, which was great. So they are ready to at least feel some of the relief, but obviously it really is dependent upon our current cases. And just as I believe Gary was talking about or maybe it was James, the fluctuations of our cases going up and down, and the flexibility that Worksite Labs will have to flex with it is 100% appreciated.
Okay. Two things about the district office. I always get concerned about those who are carrying all the weight. I know teachers are, I know kids are, like I'm not taking away from that. But also I know the administrative piece is really heavy. So will this release you and Javier's time? Will that give you any relief?
I think long term.
And that's a serious question.
Yeah, we certainly appreciate that. And I think long term, the answer is yes. Obviously, this has consumed us, but that's okay because this is the most important work, as you heard from everybody. And I'm sure we've been getting messages and contacts. This is some of the most important work. And, you know, Javier and I certainly are up to the task as we continue supporting the school sites in the district as a whole in this work.
Okay. And then the last question, I heard about testing, and maybe Dr. Williams, you can answer this question. I'm not for sure whom. I'm also concerned about district office staff being able to get their own testing. They may not be interfacing with kids, but we are people too. And so, and it changes when we're out of the office and when, you know, our staff is stretched in the district office, you know, and we want to make sure that their wellness is being taken care of as well.
Trustee Stevenson, everyone can be tested. So all staff, students, and even families are eligible for testing. So it covers
so
everyone.
This is just not about the school sites.
No, it's about our community, our entire community.
Okay. All right. All right. Thank you.
Okay, other questions and comments?
I've got a couple, Alan.
Okay.
I guess I'll say the flow charts vaccination is a key piece. There's sort of flow chart 1 for vaccinated people and flow chart 2 for not vaccinated people. Can you comment on the amount of information you have about who's vaccinated and who's not?
Sure. We have staff. Staff did attest to their vaccination status and had 3 options, whether confirming that they are vaccinated, that they are not vaccinated, or they're declining to state. If staff declines to state, they do meet they have to follow the protocols and procedures as an unvaccinated individual. As far as students, we don't have we didn't do a wide survey of that yet, but we do have the CARE system, which is the California Immunization Registry, that our health staff has access to, where students' immunizations are recorded in a central database. So we are also able to find out there. But probably the most important piece is during the case investigation and contact tracing, particularly the contact tracing, when we are in personal communication with the case and close contacts. That's where we identify if they are vaccinated or not. So that's how we gather information. Like I said, either from our staff attestation, from the California Immunization Registry that would provide a student vaccination status. That also takes a lot of time to look through, and also the personal communication that we have with the cases and close contacts and potential contacts. To put it in context, think about one positive student going through 6 classes throughout the day. And so we're talking about close to 200 people per positive student that is on campus as they move through 6 different classes with, approximately 30 or more students plus their teachers. And in some cases, we may have transportation involved there, classroom aides. And so we're talking about 200 people here that each investigation involves to determine vaccination status and potential exposure.
So I'm just wondering if it isn't an option to do some sort of I know it can't be mandated, but to ask if you're willing to share, are you willing to share a vaccination, so that, and storing that with every student, so we have whoever's willing to volunteer the information. I suspect many families would be willing to share that they've been vaccinated. I know we can't, I'm just wondering if that's an option that's been considered, and what, if yes, when, or if not, why not? Just basically, I don't know what it would be if it goes in their student information record or some way to know vaccinated, showed us a vaccination, check this box if they did, and see how much we get. Is that something that is an option?
Yes, it is an option.
And
Yes, and we,
oh,
go ahead, Dr. Williams.
Trustee, again, we have, as a team, we have been working on the best strategy to collect that information. We have more updates coming soon, and so that has been top of mind. Initially, we wanted to make sure we had some relief to our health team in terms of contact tracing and getting testing in place. And so our next level of priority is collecting that data that you're speaking about from students and families.
It'd be voluntary initially, I assume.
Voluntary, yes.
And then, so some of my colleagues, there's a San Mateo County Office of Ed put on an event, and I specifically asked about the legality of vaccine mandates, and county council's advice was that it's not legal. I don't know if other people have other opinions. I know other districts in the state have done it. I know we got some public communication asking us to do it. Our guidance from our lawyers is that it's not legal. The lawyer did suggest that it would be legal to consider mandating vaccination, proving vaccination, participate in some activities like extracurriculars and other things. And I'd encourage us to think about that. I'm not suggesting we put something in place right now, but just as a mitigation measure, knowing who's vaccinated. I've heard interest from some others on the board about mandating vaccines for everybody, but I don't think we can do that. But maybe we could consider it for certain activities, especially those activities that were described where you can't follow all the safety protocols. So I'd be interested in talking about that, maybe not today, I know you need time to prepare for it, but at some point relatively soon. Voluntary reporting of vaccination and then seeing what sort of numbers we have. And then depending on that, considering what we do next to have our schools be as safe as they can. So thank you for the presentation.
I'd like to jump in quickly, Rich, on that last comment you made. I also attended the county call, and I think the crux of the legal advice was that mandating vaccinations, as have been mandated for other childhood diseases as part of the registration process, is really dependent on either the state legislature specifically passing legislation around COVID-19 vaccination, or the public health department adding COVID-19 to the list of childhood diseases for which proof of vaccination is an appropriate part of the registration process. And I think what I'd like to recommend on that is that the Sequoia District actively get involved in lobbying our state legislature to move forward with that. I wonder if we have at least 3 members of the board that would like to direct the superintendent to take a lead in getting that action rolling and take a role in that ourselves in support of it. I'm seeing some vigorous head nodding. So with that, let's do that. I agree that the other thing that was discussed was, as you said, extracurriculars, field trips, athletic teams, where it goes outside the bounds of the free public education guaranteed to all without any prerequisites to a special activity for which students must sign up and in some cases pass some sort of eligibility test to participate. The legal recommendation there was proof of vaccination is a reasonable item to consider among that list of eligibilities. So I would like us, to look into that proof of vaccination is appropriate to require for special activities. And again, before I give direction, I want to see if there's head nodding for the superintendent.
I'd say before we give direction, maybe just get feedback on the idea.
Yeah.
Yeah, I was gonna say the same thing, Trustee Jen. It's hard for me to just say I want to do this right now because I need to think about this a little bit more, just to think from multiple perspectives. But I do have a question because we talked about some of the things outside of education. And I don't know what's outside of education. I thought sports and stuff was part of education, but now I'm hearing it's not. So can we require that? Like, I don't know what people mean by that, because I thought it was all education within the school. So I wanted to learn more about that. I think the other thing is maybe Jared or Javier can speak to this. When we've had the contact tracing, is it coming just from the classrooms? Is it coming from outside? Is it coming from our sports? Like, where are we seeing it? Or is it just, it's all over the place where we're doing contact tracing because of, places where we can't practice the distancing? Or can you tell me any of that?
Yeah, thank you for bringing that up, Trustee Stevenson. It's important to note that almost all of our exposures, our positive cases have been exposed outside of our schools. So of the cases that you see there, the transmission has not occurred on campus. And so we're happy about that, we haven't had transmissions on campus. Full transparency, we are in the middle of one investigation that may involve that. But as of all the cases on our dashboard to this date, we have not had any transmissions on site. So those have been, if the case is even on site, it has been from outside of the school setting. And they,
So are you saying outside of the school setting? What do you mean by this? Just make it clear for me because I don't want to read between the lines. Like, is it because they've hung out this weekend, they came back to school? Is it because they were playing football and they went on a trip, like, or cross or something?
not school. Of the cases on our dashboard, they have not been school related transmission. So it could be a family exposure, it could be an activity over the weekend, again, not school related, so not sports. We don't necessarily know who exactly they were with or what game they were playing, if they were playing cards or we do get information about the exposure, but what we know is that it hasn't been at school, and we know that because of the cases that have been on campus. We have not had any follow-up positive cases from people exposed to that original case. So, just as we hear a lot of times in reports that most of the exposures or the transmission is occurring from family or home settings. So outside of school would be not just literally the school buildings or premises, but also school activities. If there are school activities, we would consider that in the school, in the learning environment, as you described earlier.
Okay, that's what I was trying to get
Yeah, so that is
on.
important to note for, to help put people at ease that our indoor mask requirement has been effective for the most part, as has been reported throughout the pandemic, how useful and safe masks are. So, it's important to know that even if you see those cases, first of all, a lot of them may not have been on campus. Secondly, they have not been because of a transmission on campus, and that when we identify that case, it has not led to more cases for at school contacts.
Okay, then one of the things I would like to throw out there, thank you for, I'm sorry to just to bug you, but just to really speak black and white to me, it helps me not make up stories in between the lines or anything like that. So one of the things that I'm thinking about is that there's been a lot of outreach towards families and things that are sore. I think our rates are going up, but we still have some pockets of communities, socioeconomically, racially, all that kind of stuff, neighborhoods and zip codes that still aren't even at the 75% rate of vaccination and understanding. These are also some of the same communities that are having a hard time with getting information as well. And so I'm wondering at this point, because we're having the impact is coming back from home or back from community, that maybe this is the time we actually partner with our county to how do we do a mass education with our family. And I'm not talking about the physicians and all that. I'm really talking about an education campaign within our school that is youth led, around really helping youth understand how we can really keep our neighbors and our friends and everyone safe, right? And so I think there's a leadership opportunity here for our school district to really hone in and really educate our youth and educate our parents and really do a campaign with our parent program, with our cell program, and even maybe our student council or student advisory group, because we really need to get the education out. Because I know young people, regardless of social economics and backgrounds, aren't always taking this so seriously, right? Because they're okay, or they don't feel the impact. They're starting to feel it now because they've had to stay at home. But I just wonder if it's time to really do a colorful, all hands on deck campaign so that our teachers can feel safe, the kids can feel safe, but also get vaccinations out there. So I'm just going to put that out there.
Superintendent.
Thank you, Trustee Stevenson. We have absolutely started those conversations as well. We do recognize that this is the opportunity. And again, our team has been working very, very smart in terms of the prioritizing what the needs are. And definitely we are in early conversations with a community group to do just that. I actually engaged in a conversation with Gary from Worksite Lab about doing exactly that, a community outreach with education in terms of the benefit of the vaccine. But then also we want to understand what are some of the reasons that folk are reluctant, and we want to honor and respect that as well as we do the education, because after all, we are a district of everyone. I'm a superintendent of all members of our community. And so we just want to make sure that we're very careful in terms of the information, and we're very strategic, and also honoring the voices in terms of how folk understand vaccination, and then also the benefits. So we want to support everyone and definitely make sure that we're all safe and that we're all heard.
And mine wasn't just about the vaccination. I think that's part of it, but I also think there's critical decisions we have to make. I have to make a critical decision. We decided not to go to a football game because my husband has some things he needs to do, and it's less likely he will have anything because we're around crowds. There are things that, such as, okay, we've gotten several notices about outside. Now, I can't do anything about the child next door, but I can do something about my child. Put your mask on, hand sanitizer, those kinds of things, right? So I do think there is a level of individual responsibility that's different than vaccination. And what I'm hearing is that some of that is still happening in our community because people want to be social, they want to be connected. And we're not saying that, but just be mindful, right, about the other environments that you're going into. And so it's not just even though I feel pretty strongly about vaccinations and people having choices, but I also think we need to think as a school community of what we're doing on the weekend actually impacts at our school. So it's just something so it's beyond just recruiting for vaccination, but really.
Okay, Chris, I've seen your hands up. I just was wondering, Isabel put her hand up. Was that in response to the points that Shanice just raised?
Yeah, it was about kind of a student-run or student-led effort.
Yeah, go ahead, please.
I was just going to say I completely agree with everything Trustee Stevenson has said, and I think it is very important from kind of the younger perspective. I think many of my classmates are less concerned about COVID than they should be, simply because there is that thinking of, oh, well, if I get it, I'll be fine, because younger people are far less likely to be seriously sick. And so I think we do really need to educate students on, yes, you'll be fine, but your elderly neighbor or your grandmother will not be. And so I think the most meaningful way to do that would actually be through, as Trustee Stevenson suggested, kind of student-run campaigns. So it feels less like these students are being lectured at about how to be safe, which they have been for the last 18 months, and instead more of a dialogue between different students on the importance of protecting our community.
Thank you for that. Yes. Chris.
Trustee Steed, I remember last year when we were hearing from students, one of the striking comments I heard was their concern, not for their own health, but how they might spread it to people who are more exposed and at greater risk. Earlier, I raised my hand because I wanted to concur with colleagues in thanking Rich for raising the question with the County Office of Education. And I want to concur with colleagues about asking the superintendent to help us explore the question of vaccine requirements. Otherwise, I wanted to say how much I appreciate the speed of the staff's response, especially on the tracking and the testing. Dr. Williams spoke to the very smart work they did, but it's also important that I think the district has seen, your staff has seen how urgent it is to respond as quickly as possible. Final comment is inspired by something our student trustee and the SDTA representative spoke to earlier about the conditions in the classroom. And the conditions in the classroom really are a combination of a COVID issue and the fire air quality issue. I also really appreciated the way Leanne Strube spoke to the need for a bond initiative to do this right in the future. And it'll take that sort of resources, I think, for the retrofit of many of our classes or the the renovation of the classrooms. The question I have for staff, for our superintendent or CBO, is whether we can do more in the short term. I know a lot of work was done this past year on air quality issues and ventilation, but is there more on temperature control? And to put this in context, this is from somebody who does not like air conditioning, would not put air conditioning into our house, believes that you can put up with 2 days a year in your own house, that it's not necessary, it's not a good environmental thing, but realizes the classrooms are quite different than anybody's home. So Dr. Williams, I'm not sure whether this goes to you or to our CBO, but are we able to do more in short term on air quality, air temperature in classrooms?
We are, and I'm going to ask Associate Superintendent Leach.
Yes, so we are exploring what potential short-term solutions could be. Even with short-term solutions, a lot of them are still long-term. We wouldn't be able to install a portable air conditioning in every classroom. We know that we have electrical issues. They will also be noisy in addition, right? And so there's definitely factors, but as what Leanne mentioned earlier, when we are looking at what air conditioning in every classroom would look like, we have to look at it in totality, right? Like, what energy efficiency do we need? What windows do we need? Does the building just need to come down and we need a brand new building? So there is all sorts. We definitely need a bond to do that work. But we also know that even if we went for a bond in 22, right, selling our first round of bonds, planning, we still got a good couple of years. So what can we do right now, even to assist in any way? And I do have the facilities team working on that, and I hope to have some potential solutions and cost analysis that we could look at towards the end of the month.
Sounds like it's the right thing to do. Thank you for doing that. Finally, I'll point out our president's ultimate politeness. It brings a smile to my face, which you cannot see, is see him raise his hand when he wants to speak and presumably call upon himself. I think it's back to you, Mr. Sarver.
Oh, okay. Yeah, we'll let that Sarver guy talk next. Thank you for that. Yeah, I want to begin by thank you for the presentation, and in particular, it's excellent to see the work that has been done to bring in the experts to really extend our reach, become more flexible, do the critical work that is an improper burden on our existing staff. We have been asking people to step outside of their areas of expertise that are the reasons they're working for the district to do this kind of emergency work, and bringing in experts who are capable to be very flexible and expand and get it done right is a huge improvement. So I'm very pleased with that. And we're clearly seeing how much this is going to come online rapidly. I'm also pleased with the conversation we just had about air conditioning, and I'm looking forward to that as part of our study session near the end of the month, to be talking about facilities and where we're going to be able to go with that. And I'm really pleased that we're moving that conversation to the long-term and short-term perspectives to make sure we can do as much as we can, as quickly as we can, and do it as right as possible for the long term. And then the one kind of additional question and thought that I wanted to throw into all of this is that, you know, to such a great extent that the overall conversation coming from various groups in the outside world is schools as kind of danger points in the pandemic, and places where all sorts of draconian measures are being implemented, like mask wearing and quarantine and all of this. And in particular, kind of a sense that to some extent, testing is being held up as kind of a punishment for the unvaccinated, an onerous alternative that would help make vaccination look more attractive. And with the direction the district is taking and what this group can bring to us, I think one of the things we look at is the possibility of much greater testing. And to me, that really is an opportunity to change the conversation in a way that I think is really, really important. It is not the school environments, as we've just discussed, that is where transmission is going greatly, because the protocols we have in place, the masking that's going on, the quarantining that is being implemented when necessary, the spacing, the awareness, the education, all of these things are minimizing the amount of transmission that's going on in our campuses. Our campuses are actually places where there is a great concentration of students coming because of the essential services of education. And they are coming from a community in which there is broad community spread of the pandemic. And we are going to continue to get an ongoing number of hits of students who test positive because they're coming out of the community where it is. And we have an opportunity here for the schools to be providing the special service of being that place of concentration where anybody can get tested on a very regular basis. And we can become very successful at early detection of asymptomatic infection and really finding the students and staff members who haven't started showing the symptoms to suspect they might be ill, but that we can just find them and help them quarantine and be out of the way and be safe from that very early point and minimize the amount of infection time that it would take to wait for symptomatic conditions to emerge. And I was wondering if, Mr. Frazier, if this is kind of part of the overall plan of how you look to operate, that it can become a very far-reaching testing environment and much more of a kind of a preventative service and a way of, in the long term, handling that new normal of living with COVID that allows us to, behave more normally with greater confidence, with greater safety, and keep it minimized.
Yeah, that's exactly what it is a comprehensive solution. I think where we all went wrong, I would say, is, we thought that the vaccines were going to come along and save us all. And then we literally, we as a country, stopped testing in mass quantities like we were doing early on, when in fact it's a comprehensive approach. It's the masking, it's the distancing, it's the hygiene, it's the vaccine, it's the testing. But because to your point, how else do we find the emerging variants there, until before they're too late? And also, how else do we basically stop a spread before it's too late? And the only way you can do that is to be able to know both what's happening with the asymptomatic and the symptomatic simultaneously. And the only way that's possible is through this comprehensive approach. So you're spot on.
Excellent. I do know that our partner district, the Redwood City School District, is on the brink of going to 2 times a week testing available for all staff and students across the district. I would hope that we can be trending in that kind of a direction as our expectation, and that we can fall into this very confident preventive data gathering mode.
If I could, Alan, Don, just on that point, I would just think we'd want to look for guidance, because the Redwood City School District has a much higher percentage not vaccinated than we do, and I'd want some guidance, especially once we know our vaccination rates, as to what is a reasonable amount, and maybe 2x per week is right, and maybe that's more than you need if you have 90% vaccination. So I'd want to have some guidance before I put a specific target.
I agree with that. I want to be led by the science, but in that direction.
I will say, President Sarver, that our goal with the current logistics plan in place, we will have testing available at least one district site every day of the week. So with our schedule, we will have the ability to have flexibility as we talked about. So that will be allowable. May have to drive a little further, but there will be access daily.
Excellent. Okay, any other questions? I think this has been an excellent update.
Gone long.
Yeah. Okay, thank you very much. As was just pointed out, we've gone on quite a while.
Thanks for having us. We're going to jump
Thank
off.
you.
Bye-bye.
Thank you, everyone.
All right, and that was an information item. Before we go on to ones that actually require discussion, is there board head nodding that we would like to take a brief recess break and come back fresh? It's 8:08. Let's be back at 8:15. Everybody ready? Okay, I think we're back. Okay, welcome back, everybody. And we're ready for our first discussion item, 14.1, discussion of board policy 6146.1, high school graduation requirements. And I believe that's up to Bonnie.
It is up to me. Welcome back, everyone. So current board policy 6142.7 states the superintendent or designee may grant permanent exemptions from physical education to a student who is, among other things, age 16 or older and has been enrolled in grade 10 for 1 or more academic years. Such an exempted student is not required to pass the physical fitness test. While waiving this requirement has been a practice in the district's alternative high school for several years now, the desire is to officially update this practice in district graduation requirements. So to that end, I am bringing to you this evening Board Policy 6146.1. And if you look on page 3 of the document under item 8, you'll see that we've added in red font for your consideration. In addition, students at the alternative school who are 16 or older and have been enrolled in grade 10 for 1 or more academic years may be permanently exempted from PE. This change was requested by our alternative high school principal for a couple of reasons. The first one being that she ends up waiving it every year for a lot of students anyways. And the second one being, actually there are 3. The second one being that with the push for as many students as possible to finish career pathways, to take courses where they end up with some sort of a certificate for going forward out into the world beyond high school. And then also because with AB 130 requirements for students, AB 104 that allows current seniors to graduate with 130 California graduation requirements. This was a way to cut down on one of the hurdles that students sometimes face at the alternative school from reaching that goal. So that's all that I have to tell you about the proposed update to the board policy. I will welcome your questions in a moment, but just to confuse you, I need to let you know that as Laura Loese informed you earlier this afternoon, we had to update the board policy from the one that was sent to you in the Friday board packet on Friday. And the reason that we had to update it was because when I went to do this policy, I downloaded the current version from Gamut and I faithfully typed in the change that we wanted to have made. My thanks to Trustee Sarver, who over the weekend said to me, by the way, there's some board language that I'm pretty sure has been adopted already at prior meetings that is not showing up in this current policy. And when I went back and I looked and did a search on board minutes for the last year, I found that there were not 1, but 2 rounds of updates to board policy 6146.1. So what you have before you this evening is the current board policy with the adoptions in it that you approved on August 5th and then on October 28th. So this is the real policy with all of the updates that you have voted on thus far since our mass adoption in March of 2019, with the new suggested addition about the waiving of PE at the alternative school for students 16 or older who've been in 10th grade for a year.
This is an issue in the world of software development called version control. And we do need to be keeping track of any policies that we are updating for a second time within a fairly short window of time. We want to really make sure that Gamut has already been updated with the last round of changes we made and that we keep our eye on it. I very much appreciate your being able to track this down and make sure that we got this right. And with that, I do see some hands up. Shanice?
Yeah, I have a question, Bonnie, and maybe you can just help me. I'm actually very confused about all because we've changed it, I think last year, or I believe.
2 times last year.
Since I've been here, right?
Yeah, no, we changed.
One
we've not
during
changed it since you've been here.
we haven't.
No.
So what was changed before? I thought it was the graduation credits. This is different, huh?
This is different. So the graduation credits were changed and it was for the class of 2021 only.
Okay.
And we changed it in the 04s board policy. This year, state legislation went ahead and passed a policy for everyone that was the same as what you guys approved last year. Because it was state legislation, according to our county council, we do not make that update in our graduation requirements. It's a 1-year thing. And it gets referenced back through the legislation.
Okay, so this is different than that one. Okay.
Correct.
So I wanted to get clarification on that. And then I have another question, and I'm not, hopefully this is not out of a term, but I know when we visit Tide, they're really trying to be kind of like a small comprehensive school where they have CTE and all this, similar to some of our large comprehensive schools. How will that impact that movement? Because they're also trying to make sure kids have A through G. Remember, that's one of their visions there.
I do.
So how does that impact this?
What is before you tonight is only in reference to the alternative high school. It does not impact, at this point, it does not impact Tide.
I'm sorry, not Tide. I'm so sorry. Redwood. I apologize. Redwood.
So for Redwood, it helps
I
them.
apologize for the confusion.
That's
Sorry.
okay. For Redwood, it helps them because it's 20 fewer units where they need to get PE that they can now use getting units in other places like CTE, most preferably CTE that is also A through G approved, although much of it is not at Redwood at this point, but the staff there is working hard on that. So this allows for more room in their schedules. One of the challenges that we have had is that you have to be in at least 2 years of a CTE in order to meet a pathway requirement, and sometimes 3. And that's very difficult when you've got a student at your alternative high school where they're typically there for 2 years. So we've been condensing that and trying to make room in kids' schedules so that they can have that experience. Stephanie sent a great picture to Cabinet a couple weeks ago of a student who graduated from a CTE pathway there last year and is now doing an internship with the contractors union. And we want more and more stories like that.
Okay, so this, I apologize for putting Tide in there. I didn't mean Tide. I had the vision of Redwood and said Tide. So this will not impact their vision to be an A through G or a school that would get kids ready for college. Okay, if they want to go, of course. Okay, that was like my only question. Thank you.
Carrie.
Thank you for this, Bonnie. I do want to fully support the recommendation of Principal Ogden, but I do want to make just a couple of comments. This agenda item is reminding me of an agenda item that we had the first year I was a board member for this district when we eliminated one of the years of PE. Is that correct? And it was not a year, but we made a change to the PE requirement.
So
for the
what
graduation requirements.
The change to the PE requirement was that students, it was actually, I think before you were on the board, but I could be wrong.
No, I was on the board.
Okay, you would remember because it was
Yes.
hot.
It was controversial.
Yes,
Yeah.
yes. And just so you know, now the state has made that legislation, it's not just in our district now, it's a statewide thing.
But I wanted to bring that up because we heard from so many PE teachers, right? And PE is important and kids learn so much from PE. There's also a social emotional aspect. There's so many positive things that PE teachers are able to convey. So I just wanted to make the statement that from my perspective, PE is important, but I do understand how it can hinder some of our kids in our alternative program, especially a continuation program. And I also wanted to highlight that I was very happy when I asked the question to you guys earlier today. I want to highlight this partnership with the Boys and Girls Club of the Peninsula to offer intramural sports. And I know there are other things going on at Redwood that do offer the experiences that kids would get in PE class. So I just wanted to make those comments. Thank you.
Yeah, and I don't disagree at all with anything you've said, and I don't think that Stephanie would either. And actually in the same email or text where she told us about the internship for her graduate, she sent a picture of their first intramural basketball team, which is being sponsored by the Boys and Girls Club of the Peninsula.
Awesome. Chris?
Let me first state that I'm in agreement with the spirit of what we're trying to accomplish here. It seems pretty straightforward and the right thing to do. I also looked up the state ed code, and it's quite consistent with the state ed code that's referenced there. I may have a little bit of a version control issue that I wasn't aware of. And though I looked at the document this morning, I'm not sure when I downloaded it exactly. The question I want to ask you may have disappeared in the version control, but otherwise you might consider it a remembrance of a lawyer who served on the board who stressed the difference between will and shall and may and their meaning. And what I read was, I think, something about a student may be permanently exempt from this requirement. And if we are saying may suggest an element of discretion. And I'd ask, what if we're saying there's some discretion, what's the criteria for that? Or there's someplace we ought to articulate how the district may decide one way or the other.
I regret to inform you that after all that schooling on will versus may, this is not indeed an iteration problem. It's a problem with my verbiage. And I do believe that Stephanie's intent, and I think it makes sense for it to move to will.
Okay. To me, that makes more sense. Or upon upon request. I don't know whether parents, students make this request. A student will be exempt, or whether you just categorically say that.
I'll
I guess you
talk
could
to
just
Stephanie and bring it back to you cleaned up correctly. Please don't tell Alan on me. I'll do better next time.
I didn't even put a name down. Yes, I won't. Thank you.
Rich?
So I'll say first, I support the proposed changes. I want to make a general comment that I believe that actual practice should be in compliance with policy. And if it's not, and practice is what we want to do, that we should change the policy to match the practice. I think what I heard you say is that many people have been exempted from it already. And I believe maybe there are other exemptions happening in other conditions. And if I read this exemptions and waiver section, it sounds as though exemptions can only be made for a very selected list of people. And it sounds like maybe exemptions have been made for people who aren't on that exact list at times. And so I'd be interested in having the policy match the practice. And if there are certain things that can be exempted, that be clear. And then it not be that there's no ability to exempt in the policy, but yet it's happening.
Got
So
it.
I'm not suggesting that we make that, like, I'm going to support making this change to this today, but I'll ask the superintendent that we, if my board colleagues agree, that we have graduation language that actually matches what we do, or we change what we do to match the practice, but not have it where the policy says one thing and the practice is another. My understanding is that there is an ability for administrators to waive anything that's not part of the state requirements, but I don't know if that's actually I don't know what's waivable and what's not waivable. But
First
maybe
of
you can
all,
answer that.
I can. I'm not going to give you an answer that you like, but I can answer it. On the very, very, very rare occasion, a principal may, right before graduation, with a graduating senior who's had an extenuating circumstance happen during the second semester of their senior year, have been known to waive a requirement. I'll give you an example. When I was the principal at Sequoia, I had a senior who flunked PE. Her father had passed away that semester. I waived it. There wasn't a board policy about it. It hardly ever happens. I was a principal for 5 years. That's the only time I ever remember waiving a requirement for a student. So it does not happen very often at all, but I cannot tell you it never happens. I will tell you that when it does, it is not loose and free and we're exempting 5 or 10 kids in a graduating class from a requirement. It is for the kind of situation that I just described to you. But we can make that a board policy. That makes sense.
And I'm wondering what would happen, for example, we now have a ethnic studies requirement. What if someone transferred in as a senior? Didn't have any extenuating circumstances except they came as a senior. Because that could be a lot of people.
If a student came in second semester of their senior year and they could not fit that course in the 7, that would be a consideration, just like it currently is for life skills.
Okay, so anyway, I don't know if other people think we should have it match.
I think we should, for what it's worth.
Yeah.
We
I
can
was
bring
about to
something
say,
back.
Okay, so I'd be interested in that moving forward. I think I'd be willing to just make a motion now to accept this change with the edit that Chris suggested, unless other people have more questions, but I'll make that motion.
Well, this is a discussion item, so the direction we would give is to bring it back.
My
on
apologies.
consent.
My apologies. So it'd come back on consent?
With the grammatical change that Chris recommended. So I saw vigorous head nodding for that request for its return. Okay.
Thank you.
Thank you. And with that, I think we can move on to discussion item 14.2, our discussion of reinstatement of Brown Act in-person board meeting requirements.
Thank you for having me with you in person this evening. My name is Karen Zendes, and I'm one of your attorneys that represents the Coven High School District. The Brown Act and the COVID-19 waiver that was provided by the state of California beginning in March of 2021 has allowed you to have virtual meetings like you're doing tonight. That particular law that took place in March of last year, that executive order was in 2920, and you still reference it in your board agenda information. And then that law was supposed to expire, but it was extended through the end of this month. So at the end of September, you are supposed to resume full in-person board meetings. So that's where we are in time. Your current status in terms of how you've been holding meetings is consistent with the law as the law is currently presented. And if not for some legislation, which our lobbyists are indicating is very likely to pass beginning next month, which is very soon, you would need to go back to full in-person. So full in-person with public comment. Full in-person meetings with the public attending and with in-person public comments, and individual board members would not be able to use a remote process, either teleconference or video conference, unless they follow the procedures included in the Brown Act. So what does that mean? So right now you're having your meeting as a board together in person with your masks, distanced. Members of the public are able to call in through raising their hand on a Zoom platform. You're able to receive public comments that way. And I also understand you receive public comments and correspondence as well that you've been sharing with the public. If the law is not extended.
Sorry, just real quick. I'm getting text messages from panelists or from that they can't hear you.
They cannot hear me.
Karen, your voice just started appearing.
Oh, okay. Is it?
I'm hearing it because you're in the room, so I can't tell. But
I think it's going through now.
Yeah, I think we just got the speaker connected to Zoom.
Are you going to turn the camera on for me?
Yeah.
Okay.
I can hear that.
Okay. All right, well, thank you. This is a preview of what can come, which is a hybrid scenario, right? So I am in person with the board in person. And in order to present in person, we're adding a camera so we can facilitate the public's participation in this presentation. So just to recap a few of the comments I made earlier, at the end of this month, the end of September, the ability to do remote board meetings through video conferencing like through Zoom will end unless the state legislature or the governor extend the Brown Act waiver that's been in place.
I think now if we turn off the microphone, it would be better because now the laptop is picking you up and the microphone is making it.
I think I'm going to have assistance here on how to do that.
I think the sound's through the back, but
Plug it in.
yeah.
We can hear you through Zoom now with the laptop.
Okay. How is it now?
Is it okay?
Does it work now?
That sounds good.
All right. If it doesn't, I apologize to everyone who's watching and to the board. Probably should have zoomed in instead of met with you in person, but this is good practice for me and for the board when you go back to in-person board meetings. So just one more time, N080821 was the governor's executive order, which has allowed you through the end of September to continue with video conference and Zoom board meetings where the public participates remotely. You as board members in the past have participated remotely. Some of you may have been in person, some of you may have been remote. All of those things have been permitted under the law. All of that is due to expire at the end of this month, which means pre-pandemic Brown Act requirements go into place on October 1st, unless a new law is passed or a new executive order is issued. So what that means is the way you've been handling public comments right now through a Zoom platform where you allow members of the public to raise their hand, will have to change October 1st unless a new law is passed. Why do I keep mentioning a new law is passed? Is because AB 361 has now moved to the Senate Judiciary Committee and will be heard tomorrow. And all indications are it is likely to pass and eventually likely to be signed by the governor as urgency legislation. It is a different rule with regard to what Brown Act requirements are changed and what Brown Act requirements are waived. So we will have to revisit that as soon as that law is passed, because of course, like all things COVID, what's the one rule that we've all learned? And that's nothing is going to stay the same. Every CDPH, California Department of Public Health order that you have received has changed multiple times. Every governor executive order, every local county public health order has changed. So this too is going to change. So as a board, you need to be prepared to determine how you're going to proceed going forward. What have you appreciated over the last year and a half, and what has been challenging? So in terms of your current public comment process, have you liked that? Have you not liked that? Going forward, you'll have some choices to make. And so that's just a consideration for the board. Some school districts, I attended a school board meeting last night, have moved to a full in-person model where public comments are made by masked participants presenting at a podium like this, just like pre-pandemic. The only addition at that school board meeting was that they also allowed people via Zoom to make comments after they took all their in-person public comments, but the entire board was in person, okay? So things to consider in terms of flexibility. I'm just gonna move on to the issues that will come up if it is not extended. So if the current flexibility is not extended, the things you need to consider are what happens if one of you would like to attend remotely? Maybe you've had an exposure. Maybe you are isolating or you've been quarantined. if the law is not extended, for you to be able to attend remotely, not just be absent, but attend remotely, all the exemption rules will be back in place. So that means you would have to agendize the location of where you are attending from remotely. So I'm going to use the home example. If you are at home on your computer on Zoom, you would have to post in the board agenda at the time of that posting your home address. You would have to, on your front door or some place that's visible in front of your home, post that a board meeting was happening at your home. You would have to have a home that's accessible to the public, where the public could make public comments at your home. Those are the rules, or those are the rules in the Brown Act currently for attending a school board meeting via teleconference. A lot of us are hoping that we'll have the best of both worlds. We'll have the ability to have board members who can attend remotely. We've proven we can attend remotely, be able to attend. But if you are in a scenario where you have been exposed, you're isolating, you're quarantining, you certainly don't want to expose members of the public to COVID. So what we're hoping is if the law gets extended, that you will have the flexibility to be in person, and if you need to be remote without opening up your remote location to the public for public comment, access, and all of those things. Again, we don't know this yet, but if by October 1st, all of you need to know, if the law is not extended, those are the requirements that will be in place. So in your packet, and I'm not going through each slide, but in your packet on this particular slide, it lists all the requirements for attending board meetings via teleconference, which is also the same as for video conference. And those requirements will go back into place. So you have some options. And I've just given you some ideas. There are some variations on this depending on if there's new legislation or not. This is based on no new legislation. Everything stays the way it is, and it expires at the end of this month. So one option is just to go back to pre-pandemic, full return, full in-person board meetings, public comments live, and speaker cards are submitted for individual topics and during general public comments, and that there's no virtual option. There are school districts that have already resumed that model. So that's one option to consider. Another option is more of what I call a hybrid, where it's a full in-person return, and you allow both in-person and virtual public comments. There are other variations, of course, with your correspondence and other things that you're doing. I think I'll just end on a mask note, which is probably the hottest topic we're dealing with, vaccinations and masks. And that is that in your county, because you are a governmental office, and there are other rules that apply to K-12 and when students are present, that in your county, all your board meetings have to be masked, and clearly you know that. And the more challenging aspect is every member of the community that comes into your board meetings will also have to be masked. And you're required as a school board and your administration to monitor that. Okay. So with that, let me just answer any questions that you might have, or if there are any concerns that you want to share. I think now would be a good time. Trustee Stevenson?
Yeah, the question I have, can you go back to the public comment?
The options?
Yeah.
Sonny, if you want to unmute.
Oh, okay.
It was how do you give how do we give public comment? One thing that's not on here, I think we talked about. You still can't hear me? Okay, hold on. All right, can y'all hear me now? Okay, I'm sorry, got all confused. What was I gonna say? Oh, the public comment, something that's not on here. I know President Sarver does a good job of reading people's public comments. And I think that's fairly new practice, if I remember. But is there any way, let me go back. Let me tell you what my concern is and how I think public comment can work. And I wanted to see if it's available to us. I have concerns that individuals that live with the traffic and everything, and traffic is going to pick up, that they won't be able to come to a public meeting. And I know there's other ways that we're thinking about doing rotating meetings and all that, but we're not starting in October. So I'm thinking, how can communities' voices be heard around some of the hot topics that will be on our agenda, right? And so I'm thinking about a written public comment process where people can at least submit without going to a meeting. Right now, they email President Sarver, but I also think that's a little confusing because we all know if we're supposed to do something with that public comment because you're coming to him for a concern, or if it's a public comment and they're not expecting a concern, but they want the whole board to hear it. And so I'm just trying to figure out that piece to maximize the voices that need to come, but may not be able to come in person for various reasons.
So it's helpful, I think, to look at two possible different roads, right? The road that we're on right now is that the flexibility expires at the end of this month. A likely road could be that the flexibility doesn't expire. So on the road we're on now, the board could decide to do a few things. Different districts do it differently. One of the things that some school boards do is rather than having anyone read out the comments, they encourage the comments and then they distribute those comments with a certain deadline to the board in advance. So they're not read, but each of you has an opportunity to review them and see them before the meeting. In school districts where they receive a huge amount of written public comments, that seems to be the most logistically productive way to do that. So that's one way to do it. Assuming the second road where the legislation is passed to extend it on some basis, you can kind of do the best of both worlds. The example that I experienced last night, which is you have access to the public in the room to make public comments. You call on the public that's present first at the appropriate time, and then you go to some sort of a queuing system rather than a hand raising or some sort of pre-scheduling, where you identify who's going to be unmuted at a particular time and allow them to make comments. And that's a hybrid. That's certainly what you've been doing. You would be just adding the public component. And then the bigger issue is the regulation of the board members themselves in terms of needing to be present, or if you're not, having all these additional rules attached to your remote location.
Mm-hmm.
Does that answer?
Yeah, I think that does. I like the idea of the written comment, even if people can't be present, just because I just want to offer flexibility for people. So my question is, and it's probably a little bit more detailed. I know City of Menlo Park, if you do written comments, or even Redwood City, you can do written comments, and then it will be part of the record, but also part of the minutes. Are school districts required to record those public comments and put them into minutes?
So in terms of the written comments, those documents do immediately become public records. So any comment that's provided to the board immediately becomes a public record unless there's some exemption that would allow the district to redact portions of it. It involved a personal summary of a student's journey with their name and their school site or their teacher. There's certain circumstances where things will be redacted, but in general, those documents become public records, and many districts do attach them to their board minutes.
Okay, so we actually could do a separate email or logging system just for that, just to clarify what are we supposed to be responding to and what's just being commented on a board. Okay. All righty. Thank you.
Thank you.
So my question, if we go with the best of both worlds option, so this is a Brown Act question. I thought that we had the right to require the member of the public to provide their full name. In a previous district, we asked them to provide their full name as well as their address. And that was put into the record. And I'm wondering if we can require that. And also, can we require the camera to be on? Because during some very heated conversations, there were sometimes I've observed, and I also watched other school board meetings in the county. I just feel there's more decorum when you show your face and your full name. And for me as a board member, especially if staff is addressing the board, I like to see who that person is. I remember faces. Can we require those things?
So at one point in time, I can't tell you how long ago, Trustee Dubois, you could request that information. Currently under the Brown Act, it's optional. You can ask for it, but you can't mandate it. Under this proposed new legislation, AB 361, there is some information in this legislation, if it does pass, that talks about various platforms for remote meetings, because some platforms, not public entities, but some platforms require identifying who you are before you can have access to the platform. The new legislation would make that permissible, that these platforms require it. And so that's a little bit of a change, but as we sit right now, you can't mandate a name and an address. Yeah, I'm sorry for that. So some platforms, you have to register in order to have access to the platform to present on Zoom. And so this new legislation, if it passes, includes an exception to the rule where you can't mandate it to allow for it if an outside vendor requires it in order to have access to the platform. But I do understand what you're saying with regard to decorum and civility. Anonymity does encourage certain behaviors that if people were identified, they wouldn't use.
I'm just wondering about when, I guess, if this new law passes, then will be extended to when we have to make a decision, or even with the law, we might have some decision to make. So sort of when might we make a decision, and when will we know what our options are? Will that be by 2 weeks from now?
So it's hard to know. So you need to assume, because of where we are in September, that October 1st, that you're going back to the pre-pandemic in-person board meetings, in-person public comments. But as I mentioned, the State Judiciary Committee is hearing the legislation already passed the Assembly tomorrow. So it could be fairly quickly, because if it is signed by the governor's urgency legislation, it would take effect immediately. So at your next board meeting, you may have that information. If you don't, you need to plan for your following board meeting for that to be full in person, both the board and the public with masks.
And we need to decide before then about what we're going to do about people commenting from remote, which means we need to do it in 2 weeks.
I would recommend that you either go pre-pandemic entirely, which would not include the hybrid, which is the default, or in 2 weeks, you make that decision as a board.
For what it's worth, I think we have to, I feel strongly that people should be able to tune in from home and still make a comment. I mean, almost always the comments are very appropriate and respectful, and the convenience of being able to be at home and tune in, and I think is the right way for us to serve our constituents. That's my opinion.
So I would agree with that. I think that, board conversation up until this point has been about how do we continue being as inclusive of the community as we have been while we go to in-person meetings. And to me, a hybrid approach as described is very attractive. That, we are holding in-person board meetings. Potentially there is some opportunity at need for board members to participate from remotely. And since we've been meeting together, since we've begun physically attending again, we simply have all been here all the time. That's been our intent. We feel safe in doing that. So it would be at some kind of need that either would have been an absence or remote participation in the old world as well. So being able to take full advantage of that when appropriate seems beneficial. I think we have been interested in board members not doing their participation on Zoom, but returning to interacting in the boardroom with microphones and our built-in monitors, and coming up with some sort of a mechanism for live streaming that's separate. So that would involve some kind of a technical proposal around cameras in the boardroom and things, which is kind of the lead time that I'm concerned about. We need to have a technical proposal we can approve and work with, and then time to implement it.
Sorry, I think maybe we should think. I personally would prefer to just stay like this than to have some big camera, but I don't know how other people feel.
Yeah. May I just share, as a participant who was attending in person without a computer open, I attended the portions that were not audible in the room by my iPhone. When you do open your doors to the public to participate, you will have to have some sort of technology in place so that they can access the presenters who are attending remotely. So, depending on what the law provides, this may be, as you are tonight, your continued normal. But if you revert back to a different process and you're going to do a hybrid, you will have to identify means to address the technology aspects.
You're saying when people come in, they would need their own technology to be able to listen to how the public meeting.
They would, to be able to participate, they would need to be able to hear all of the participants who are attending via an alternative route.
That doesn't mean each person would need a computer. It would mean that we would need to at least project.
Your microphone's not on.
So what it means is that we would need to project the Zoom or something in order for people to hear. I wonder.
It's challenging with feedback and all kinds of other things. In the meeting I attended last night, they did have the technology where the board members were not on Zoom simultaneously. They were projected on Zoom as a group, and then their presence was projected in the room on a screen. I don't know the technology aspects. I'm just sharing some of the logistics that the board should consider.
Because I would behoove us to kind of think about what some of this, only thing I have referenced is city council meetings, because I've gone to up and down the peninsula. And they're different. I mean, they were able to train, the ones who didn't have theirs posted, like East Palo Alto struggled and went to Zoom and did a great job. But there have been other cities like City of Redwood City. There's been a couple of city of Menlo Park who already had some technology in place that allow for Zoom, but also the streaming of our meetings and things like that, and still able to make comment. And so I just wonder if we can learn something from our city council counterparts who got in looking at the technology piece of it in the public comment.
A hybrid requires a degree of logistical and technological investment to be able to do it well.
Yeah. Thank you.
Thank you.
So I do think the board needs to look to staff to provide us with some technical recommendations about how we could do that streaming. It may very well be that for the board members to remain on Zoom on our own devices, maybe as long as masks are required, might end up making sense. I think trying to interact without real up close, speakers and headphones and two-way screens while we've got masks on would be just a mess. I mean, we've heard as one board member or another takes off their headphones, all of a sudden they kind of go out of communication with part of the group, and the difficulties we kind of had getting, Karen kind of plugged into communication and stuff this evening. It might be that for us to stay on Zoom is the easiest way to do it. In the long run, when we're not masked and things, I would hope that we end up, having a video set up where we're broadcasting as well. But then on the input side, to me, I think being able to take anybody who's in the room to come up and speak at the podium, and then follow up enabling Zoom from home, as we have been in this mode, is probably, a pretty good way to go. I think we have had relatively minimal abuses, and we've gotten more and more adept and used to managing that environment.
I have one quick comment, but I think Leanne had her hand up. I don't know. Oh, she's okay. Unmute myself.
The comment I wanted to make, pre-pandemic, we used to have the agenda and presentations on the screens. And if we're going to have people come back into the room, we may want to do that again. Makes it easier for members of the public to follow what's going on. And we do have members of the public who at times will stay for our entire meeting. And if the room got crowded, how does that work? Because we still want 6-foot distancing, correct? That could be awkward if there are a lot of people that want to be in the room.
The distancing seems to have been limited in the districts where they have resumed full in-person already. And it's a challenge, and it's a monitoring issue in terms of how many people you'll allow in the room. Again, evolution and change is part of this. So certainly San Mateo County Public Health could supersede some of these Brown Act rules in terms of in-person, and could say that social distancing is back in place, or close public venues like this completely. All of those things are possibilities. So that's another consideration for the board. If the current path doesn't change, you do have to include members of the public in the audience and give them a full opportunity to participate. If this new law does pass, which is projected to pass, then you do have options, and you can look at hybrid models. So hopefully you'll have the time to do that and consider the logistics, because as a board, as a public agency, you do have the authority to have certain rules in place to protect the community and protect yourselves and protect your students from exposures.
I have a feeling we're going to return to this discussion in 2 weeks. And so I'm going to be very brief, just to state, I probably concurring with my colleague Rich, that giving the opportunity for people to comment at a distance, I think is in our interest, our public health interest for the long term. That's not going to go away October 1st. So that's going to be my strong preference, is to keep that unless legislation tells us otherwise. But I think we work out a lot of this in 2 weeks.
And I would agree with that as well. And I also think it reflects on the previous point that if we have basically a socially distanced arrangement of chairs in this room, we very rarely had a circumstance over many long years on the board where the number of chairs we deployed for the public was in any way stressed. On the very rare occasion, we would have a pretty full house, but a lot of them were people here for early presentations who then left. And I think as long as we do have channels open for commenting from home and live streaming going on, I think the crush of people coming into this room would rarely be a problem. And I think we could probably then maintain a health-driven safety limit number of occupants for the room and stand by that with the confidence that everybody who was not able to get into the room and was at home was still able to be fully engaged in the meeting in a two-way manner. So I do agree that it sounds like legislatively we may have some time before a final change decision is necessary. But I think there was pretty much agreement around the room of the things that we are eager to get to, and the request for staff to kind of come back to us with technical recommendations about how to implement it. Was the superintendent clear and comfortable with the outline of what we'd be looking for?
Yes, absolutely. So we'll return with some options and a technical proposal.
Okay, does anybody have further questions? There was one other item that was brought to my attention earlier today, which may be a current compliance issue, that in attending a Brown Act presentation from CSBA, our Ms. Loisy brought to my attention that there was a question and a response about board voting during Zoom electronic-based meetings. And the response she was given was that during the period of time that there is the Brown Act relaxation in favor of electronic meetings, every single vote that a board takes is supposed to be a roll call vote, which is something of which I was completely unaware. And we have not deviated from our longtime practice of only a small number of resolutions and serious action items being called for a roll call. Many of our votes during the course of a meeting are hand raising and usually unanimous. So we approve the consent agenda by roll call, but we approve the overall agenda by a show of hands. Is that actually a place where we need to clean up our practice?
Not to give you legal advice in a public environment, but it would be a good idea to revisit the roll call vote. Again, it may be for 2 more weeks.
Yeah.
Or it could be part of this new legislation. So I will flag that as I'm reading the new proposed legislation for Dr. Williams, and I'll send her a message on that so that going forward, if this continues, that you'll be in compliance. If not, it would go to pre-Brown Act rules, which only require a roll call vote in certain scenarios like the ones you've described.
Okay. All right. So I would have no problem with picking up a practice of saying we need to overkill and do roll call for everything for the time being, if that seems to be appropriate. There's certainly been no intentionality to shortchange any legal requirements.
Yeah, in the instances where your vote is unanimous, it's less of a concern. And the reason for the law originally was to address teleconference attendees so that you could actually hear and understand how they were voting, and that language got brought forward into the relaxed Brown Act rules during the pandemic is what happened.
Okay.
We
All
were
right.
also new to Zoom board meetings at that time.
All right, so I would propose to the board that we plan to use roll calls until we get clarification that we should
I
not.
propose we only do it if it's not unanimous. If it's not unanimous, then we do a roll call so it's clear who voted which way. But if it is, that we continue our current practice. That'd be my suggestion.
that seems sensible to what was just presented to us.
I think you're in a safer situation with that suggestion, but to make sure that you're precisely compliant, I will communicate with Dr. Williams regarding what the rules currently require and what they might require under the new legislations, just so that we can follow both of those.
Okay. All right. And we're likely to have more conversation in a couple of weeks.
Thank you very much.
Thank you. Okay. We bring us on to our action items. And item 15.1 is approval of employment agreement with interim assistant superintendent of human resources and student services, which may also be the answer to the question of who is that gentleman sitting over there and why has he been here all evening?
And so, yes, we'd like to introduce interim assistant superintendent of human resources and student services, Dr. Barry Schimmel. Dr. Schimmel, would you like to say a couple of words to introduce yourself?
He needs to be promoted to panel.
The panelist.
If he can accept the promotion sent.
And then,
well, thank you for having me. Thank you for having me, and I'm excited to be here. I'm in day number 6, and it's a wonderful staff to work with, and I hope to be able to provide the transition while you're hiring a new assistant superintendent for human resources.
Sorry, just real quick. I think if you're able to turn your camera and microphone on so the people who are tuning in from home could see you, I think that'd be great.
That'd be great. We'll start over again. There we go. Thank you very much for having me. I'm in my 6th day in Sequoia, and I'm pleased to work with a very talented staff and hope to be able to keep the transition going until the board's ready and able to hire a new assistant superintendent for human resources.
Okay. Thank you.
thank you. And so our recommendation to the board is that we would accept the employment agreement for Dr. Barry Schimmel to assume the position of interim assistant superintendent of human resources and student services.
Okay. I'm looking, I see there is some public comment on this before the board takes action. So ask Leanne.
Thank you. I just wanted to say SDTA is very grateful to Mr. Schimmel for filling in because of course we really need a functional HR department. But we question why the compensation is so very far above the normal salary schedule for the assistant superintendent position. And that's the comment I'd like to make, where, you know, the 38 days that Mr. Schimmel will be with us, that would hire a teacher for a year on a starting salary.
Okay. Appreciate that input. Are there, now that we've heard public comment, are there board questions, comments, or a motion of approval?
I'll move to approve.
I shall second.
Okay, assuming we first have a shot at unanimity, all those in favor, say aye.
Aye.
Aye. All right, that is unanimous. No need for a roll call. It's all of us. So thank you and welcome aboard. All right, this moves us along to our action item 15.2, consideration of adoption of resolution number 1695 for the 2021-22 GAN limit. And this one will be by a roll call vote.
This one is by a roll call vote. So this is what I refer to as a housekeeping resolution that is brought to you this time every year, right before you approve unaudited actuals. So the GAN limit was born out of Prop 4 back in 1979. It limits the growth allowed in appropriations by both the state, local governments, including school districts. And so that's adjusted each year based off of inflation and changes in attendance for certain school districts. So the board resolution acknowledges that staff has done both the calculation for the closing year and then also the upcoming budget year, or the current budget year that we are in. So staff asks that the board approve via roll call the following resolution.
Okay. Are there questions or comments from the board, or a motion for approval?
If there are no comments from the board, I'd be happy to move that we adopt resolution number 1695.
Second.
Okay, and now can we have a roll call?
Student trustee Stead,
Yes.
trustee Thompson,
Yes.
trustee Stevenson,
Yes.
trustee Ginn,
Yes.
vice president Dubois,
Yes.
president Sarver.
Yes,
Motion carried.
thank you.
Oh.
Okay, and this brings us to our last action item, 15.3, consideration of approval of unaudited actuals financial report.
Yes, okay, let me share my screen. Let me move all you fine people. Okay, can everyone see my screen? Okay, thumbs up. Okay, so tonight I do have our controller, Dina Stewart, here with us to also answer any additional detailed questions that you may have. But as I start, I would like to thank Dina and her staff. Unaudited actuals, which is our financial report for our annual statements. So it's all of the financial transactions that occurred in our previous fiscal year. And if you can remember the start of our previous fiscal year, that was June of 2020, which seems kind of like the Twilight Zone. So in June of 20, we were approving a budget with so much uncertainty, probably the most uncertainty that I have seen in my career in school business as far as states approving budget. We were facing all of these different scenarios, if the HEROES Act were to be approved, if additional CARES Act money would come. And so we were approving this budget based off of a complete set of uncertainty circumstances. But it turned out pretty positive for us. We did receive a lot of COVID dollars that definitely helped us return to our spring, and then also return to full in-person learning for this year, and then also have some money to continue recouping from what we just don't know of COVID yet. So as you've seen our standard financial reporting timeline before, unaudited actuals happens in September. Although it's one of the singleton reporting times, it very much is not a singleton time within the business office. So during the time of close, which starts back in June when we're booking accruals all the way up until the actual books are closed, we are still gearing up for the start of school. We are still working on staffing. In addition, all of the normal business transactions that occur while closing the books, and then also the additional COVID reports that are required that we've never seen before, which I think Dina's like up to, I don't know, I think an additional 9 different reports on that. So to look at our general fund in revenue, so that's our Fund 01. If you're looking at the SACS reports, which is the state financial system, we receive just over 155 million out of our property taxes, including a small portion of state aid. That 155 million does include our payout for our charter in lieu. So we pay out to our charters just around 15 million each year. So if we were to add that 15 million to our LCFF sources, we're around 170. Our federal revenue came in about just above 9.3, other state slightly above 16, and then other local just under 17. And so further in the presentation, we will break down where those numbers lie, why they came in, where they came in at. So when we look at the property taxes, again, the primary source for the revenue that we receive, it's broken down into several different descriptions. So you can see that through homeowners exemptions, timber yield, subdivision, secure, unsecured, supplemental tax, and prior years. So we're just above, we're just actually just under 160. This does not include any RDA payouts. And so we'll go over that in I believe the next slide. We did project for 2021 at estimated actuals a 6.6% increase over prior year. And the percentage came in at 6.43%. We do have in the MYP, which is not presented during unaudited actuals, a 5% flat moving forward. So when we look at our revenue summary, again, LCFF, basic aid, that's our property taxes. The revenue has 3 different sources: state aid, property tax, and then RDA, residual payments. Since estimated actuals, there was a $4.6 million decrease. That results of 2 separate events that occurred within our RDA categories. So in August, the district received notice from the county tax collector regarding a recalculation for our 1920 RDA disbursements. That resulted in a $1.2 million reduction. In addition to that, there was also a $1.5 million reduction due to a settlement between the county tax collector and then the city of Redwood City. So that is taken and booked out and shown to you in the financials for unaudited actuals. Again, secured property tax ended with 6.43% growth over prior years. It represented about a $248,000 decrease than what was projected at estimated actuals. Our state aid projection came in as planned for at 3.3 million. So in federal revenue, we projected 10.8, 5.1 million of that is directed towards COVID relief. The accounting guidance for federal funding permits districts, we can only recognize the revenue as we spend it. So even though we get a large award, we can't actually show that on our books and realize it and receive the cash from it until the expense actually occurs. So you'll see that influx of the revenue on the books with matching expenditures during the financial reporting times through the year first interim, second interim, even potentially at estimated actuals, but then at closing, it's backed off because those expenditures never came to fruition during that budget period, which means the revenue also cannot be booked at that time. So for state revenue, similar to federal revenue, as far as how the revenue and the expenses are booked, especially on the restricted side, there was an influx of COVID relief funds. The district was awarded 7.6 million. We received 7.2 for 2021. Other major programs within this category are our career technical education. Often we hear them referred to as CTE, and special education. The 7 million decrease in revenue from estimated actuals, again, is to that deferral in revenue. So you'll probably see that back added in at first interim presented to you in December. You have CTE and then the COVID relief programs in the amount of 1 million and then around 6 million respectively. So for local revenue, we experienced a 1.4 million decrease as compared to estimated actuals. This is just to the decrease of school site not generating that revenue. COVID delayed our opening, which delayed the fundraising, which delayed the rentals, and all that local revenue that we usually realize each year. So at the end of the year, we have that decrease from previous reporting times. The remaining 400,000 is due to a recent loss of a grant that we are trying to resecure as well. So when we go to expenditures, we break those down into large cost centers to kind of digest a little bit easier. And so for certificated salaries, we spent about 77 million. The costs are 2.7 less than the projections at estimated actuals. This is primarily due to unrealized expenditures from expenses that we had planned in the expanded learning opportunities grant. This grant is part of a variety of additional COVID funds. Again, upon this grant required us to develop a plan, put the budget in, match the expenditures, right? So there's the regulatory program management of funds, and then there's the actual finance regulatory reporting of the funds. And those, the state's getting a little bit better, but they still don't match up. So that's why you see plans saying we're going to spend, and then you see financials hitting some of those targets and then transferring some of those numbers to future financial reporting periods. For classified salaries, we finished the year at 28.6. The costs reflect a slight decrease of 250,000 and projections estimated actuals. You can see that projection is a little bit closer than your certificated salaries. Benefits are tied as a percentage to your salaries. So with that large reduction on the certificated salary side, you will see that corresponding reduction with the benefit side. So this is a $1.4 million decrease from estimated actuals. Benefits for our district, which include all of our unfunded STRS and PERS retiree benefits. I say unfunded as an unfunded mandate from the state, as well as our health and welfare benefits. And I believe we have some other types of insurances. That's where we, all of our taxes and so forth are all also gathered in our benefits column. The total in supplies, you see a big difference in that cost center, again, tied to what I explained earlier, COVID funds coming in, plans required, you show the revenue, you show the equal amount of expenditures with that. So for supplies, we spent about 6.7 million. That's a 7.7 decrease from estimated actuals, again, due to unrealized expenditures related to COVID. As you can see, this year was 100% COVID, right? We were in COVID that entire fiscal reporting year. So a lot of our numbers don't look anything like they have for our district in previous years. For Services and operating expenses, we came in at just shy of 18.5. This cost center decreased overall around 6.5 million from estimated actuals. Again, this is more of a savings instead of a decrease related to COVID, even though the savings was kind of caused by COVID. It was unrealized expenditures within different COVID-related funding sources, as well as MPS contracts not being utilized as they were originally budgeted through the year when we didn't know what COVID would look like for some of our students. And a reduction to legal and a $450,000 savings overall. So there was a decrease in capital outlay of about $558,000. This is due to reclassification accounting transaction for prior period for capital projects and expenditures. This is in Fund 01, so this capital outlay does not tie to capital projects that we see in our bond fund, Fund 21. So when we look at an audited actuals comparison to our 21-22 budget, we can see that the numbers are tracking in the right direction. However, you can see the decrease in the revenue. You see your LCFF basic aid, again, our property taxes, the trajectory is going up. That's fairly standard for us. But when you see the federal and the state revenues, you see that deep decrease. And again, those are related to the COVID funds. As we start to realize commitment letters from our foundations and some of our standard rentals, and we gear back up with our fundraising, I am sure that we will start to see that local revenue come back up to what we have been used to. So for certificated salaries and classified salaries, we see that the step and column is budgeted in there. Employee benefits has that 5% increase. Again, supplies and services are based off of prior year with any type of expenses that we could anticipate for COVID. We do have our transfers out that go to our food service department, which you will see later as well. So we have an overall total expenditure from audited actuals to budget of a difference of around 10 million. So when we look at our reserves, so when we look at the reserves, we understand that the board has board policy and does, like the district, when possible, to strive for an 8% reserve. And so we have shown those numbers here, and we do show them anytime we can meet that 8% reserve. So this is your ending fund balance breakdown. So you have your net beginning fund balance. That's the audited fund balance from the beginning of the year. You obviously plus your revenues minus your expenditures. So we do have some assignments here. These are standard that you would see during unaudited actuals. The assignments that equal the 8.6 million have the following breakdown. So 3.6 for COVID. Again, those are COVID expenditures, money that fell to unrestricted money that fell to the ending fund balance that we have identified. We have 2 million set aside for the Genentech settlement. We have been planning for this Genentech settlement for several years. We still do not have any firm information on exactly what that amount may be or when they may come to collect. We have 1.5 million set aside for tech refresh. That was not in the MYP at budget time. We will be moving that expense along with the Genentech settlement and try to build those into our MYPs. And then also we have allocated 1.5 million in our property tax decline. So what I mean by that is, as presented earlier, with the reduction and the payback for the RDA, we need to remember that based off of the report that we received back in 2018, we are currently receiving around 9 million each year up into the year of 2030. So in 2030, if the numbers just stay the same for the sake of this conversation, we will receive 9 million less than what we currently have today. So that is paying for ongoing expenses with a modified one-time revenue, right? So we know that this revenue has existed for a long time. So what we need to be able to do between now and 2030 is to be able to start capturing some of that. Where do we have the savings? Where do we increase the property tax over prior year? Where's that sweet spot to make sure that we're covering the expenses of that 9 million so that we don't feel that pain all at once moving forward starting in 2030? So we finished the year available reserves about 13.2%. So in other funds, Fund 08, it's a new fund. It's a new requirement through our accounting standards. It captures any student activity ASB funds that we also are aware of. Fund 09 is charter schools. So that's our EPAA school. Revenues were at 6.1, expenditures at 6.3. They do receive a contribution from the general fund that covers expenses that are outside of their charter school operations, such as maintenance and utilities. Fund 11 is adult school. Revenues were at 2.1, expenses at 2.2. Any deficit is covered by their beginning fund balance. Fund 13 is the cafeteria fund. This is used to record the income and expenditures of our district's food service program. You can see those revenues, right, really down, just under 400,000 with expenditures of above 2 million. So the deficit was covered from a contribution from the general fund. We normally have a contribution from the general fund into food service, but we are working on a plan to reduce that and to keep our food service money as much internally as we can. And so there will be a plan coming to you in the near future on how we can start to mitigate that money coming from the general fund. Fund 14 is deferred maintenance fund. One of the things that I was so happy to see when I started working here in 2019 is our healthy fund for deferred maintenance. That is why we do have these great looking facilities, even though they currently don't have air conditioning. This money is not for that. This money keeps up your roofs, it keeps up your paint, it keeps up your fields and your fencing so that the exterior and sometimes actually some of the infrastructure is able to be kept up. So revenues were at 36, and it's usually from interest, and expenditures just over $500,000. So any deficit will be covered by beginning fund balance. Again, it does carry a beginning fund balance. So Fund 21, that's the remaining bond funds that we have. We will be closing out this fund and spending all of that money in this reporting cycle. So we have revenues of just under 140,000 and expenditures upwards of 9 million. I guess that's the closeout of our Tide project and any other loose end items that we have to close out our bond project. So Fund 25 is capital facilities. This is where we collect our developer fees. Revenue for collection of the developer fees last fiscal year was just slightly above 2 million with expenses in 134,000. So this money can be used to pay for growth as well as certain infrastructure buildups, modernizations, as long as it's tied to growth. Fund 35, that's where we have been fairly fortunate to receive state matching funds for some of our qualifying projects from OPSC. So that is recorded there. Revenue last year, as you could see, we had some projects that definitely paid out for us at just under 20 million, with expenditures about 207,000. So this money, along with Fund 25 money, can be used towards capital facilities. And I will be preparing a plan, any type of temporary relief for air conditioning. The money could come from one of these, from Fund 35 potentially. Fund 40, that's our special reserve, capital outlay. Revenue is just under 300,000 from earned interest and then a repayment, and expenditures of just under 300,000. So it's really a self-balancing fund for the district. So to end on our SERP trust account. So if you recall, I believe back in 2018, a couple months, I think it was April 2019, right before I started, the district opened a SERP account to pay for our OPEB liability. And so I've provided you 4 statements from September of 20 through June 30th. So even in the wild, wild west of COVID, we had some gains last year, but then to also kind of step back from those gains and put it into perspective for you, to fully fund our OPEB, we would need roughly a balance of 60 million. So again, thank you, Dina. Thank you to your staff for closing the books, and look forward to our next financial reporting period, which is also working on our audit.
Well, Chris, I see your hand shot up.
It's shot up. Yes, that's an awful lot of material to go through. I want to thank Crystal for giving Rich and me the opportunity to quiz her yesterday. We spent 90 minutes asking her some detailed questions, tough stuff. The takeaway that I think I want to share with my colleagues, my takeaway to share with my colleagues and people listening in, is the financial position of the district is very strong, as it has been before. The financial management of this district is something we can feel very confident about. If there are anything to continue to pay attention to, or the deficit side, are those things that came up at the end, the OPEB, the other post-employment benefits, which is an unfunded account to the extent of $60 million, as Crystal mentioned. That's something we need to pay attention to long-term, I think, for the interest of protecting the benefits for our retirees. And the other is the surplus question, and the balance of the surplus. Because we're not a revenue limit district, or one that depends upon state funding, we depend upon the local revenue coming in. The Legislative Analyst's Office made a recommendation a couple of years ago that amount should be at 17%, which is only 1/6 of a year budget. And so I think if we're cognizant of those and stay aware of those in our strategic budgeting, which we paid a little attention to, we should feel good about the district's position. And as you might guess, I'm going to vote to approve the unaudited financials.
Okay, we didn't ask for public comment before the board members weighed in. So I would ask for Leanne Strube to give us her thoughts.
I'll be super brief. I just thank you very much, Ms. Leach. That was awesome. Although numbers and me, I'm an English teacher for a reason. So what I would want to say is the SDTA Budget Committee is very much looking forward. We'd love to have 90 minutes with you too. And so we can spend some time understanding everything you just went over. And I'm very grateful that I'm not on that committee. Thanks.
Okay, well, I would second a couple of the points that Chris just raised, which is that the OPEB has been a matter of concern to this board for several years. We've taken small steps to set up and have the mechanisms in place to try to address it, but we have not gotten into a habit of regularly and fully funding it to actually meet those obligations. And I believe to a great extent, the conversation has often been along the lines of, well, almost nobody is doing it. So, you know, who should go out and put themselves at risk trying to take care of that problem. But I don't think that relieves us of the responsibility of being aware of the long-term problem and making plans to deal with it. So I do think that it's something that should come back to the board for conversation again and think about. The other comment as well on the reserve levels, I would second the 17% figure that it was raised in the CSBA Masters in Governance training on finances, that represents 2 months of operating revenue, which is kind of the guideline of what you better have in the bank as a minimum. I know that when our board put in that 8%, that was seen as a little bit of a bold statement, but the board's will in that conversation was expressed as really it should never be below 10%, but probably somewhat higher. And I think that 17% remains a pretty worthy goal to have in mind. And I know that we do try to have a lot of contingency built in and some buckets from which we can find some of the money we might need in one circumstance or another. So I kind of follow along with all the reasons to be confident and pleased and supportive of this approval, but recognizing that we have work to do and we have to keep our eye on the ball going forward. And Shanice, you had something.
All right, so I don't understand all the budget stuff. I always forget the terms and all that good stuff. So I was like doing a lot of work over here trying to remember what all these terms mean. But you did a good job, Crystal, even though I don't understand everything. But I do have one question, like two questions. One, you mentioned the Gentech settlement. Can you tell me what that is?
Ina, do you have more information than I do?
I don't have more information, but what I can say is that probably about, let me see, when did I start? 4 years ago. About 5 years ago, there was the initial Genentech settlement payout. For whatever reason, that went back to court, and that's what we're in the second round of litigation at this point. And it's still up in the air. And so we don't know what that impact is going to be. So I guess it was negotiated during the first settlement that the liability was going to be kind of spread over a certain period of years. So it wasn't going to hurt any one district like a big impact on any 1 year. But that all of those details haven't been worked out. So we don't know if it's going to be a one-time hit. Is it going to be spread over many years? If the formula for penalty is going to be changed, we don't know any of that at this point. So we're just staying tuned with the county, and hopefully we'll have an update soon, so we'll know what that actual impact will be.
You know, I might add a little bit of the initial history to that, because it's a very strange case. Genentech's in the northern part of the county. It's not a company we collect property tax from, but they were probably overassessed a number of years ago. beyond the point that they could make the correction that could be made, the correction could be made locally. And so by law, they distribute that debt across the districts of the government agencies of the county. So it's unfortunate. I think Mr. Sarver will confirm this. It's very sad that we're paying for a correction that was actually something that northern part of the county collected, but nothing we can do about it. Does that make sense, Shani? So you know where it comes from anyway.
Okay, well, okay.
But I see you still frowning. I'll say, I mean, it has to do with property tax. It's property taxes.
Okay.
They had to pay a really big property tax bill, and then they fought it and they got it reduced. And then it has to do with that.
Oh, okay.
It also do
Alright.
with property tax payments.
Boy, you can really read my facial expression with all this mask on and my glasses and a thing on my head. You were real good. So my last question, Crystal, is I'm learning through my master's in governments class. I might have listened wrong, so just FYI. But this deficit piece of it in the red, should we be deeply concerned about that?
Oh, it depends on who you ask. I mean, we all strive for a balanced budget. Do they exist here and there? When you get an influx of COVID money and then you're not in school, I guess then you have the right climate to not deficit spend. But when schools, this is where I get on my soapbox, when schools continue to not be funded at the appropriate amount, including our basic aid district, you will see that our operating expenses will always exceed what our revenues are, especially in the peninsula where how expensive it is to live here, right? Like that is all tied together. And so you won't see as much red here as you would potentially in a district outside of the Bay Area. You tend to see a little bit more red. You're going to see red here and there, but our deficits are not alarming.
Okay. All right, I got other questions, but I don't think it's for this time. I just need to understand what I'm reading, but.
Sure. And you know what's really helpful? I would love just to meet with you and we can go through actually this thing that nobody wants to look at because it's actually really easy to read. I have some tricks, so we will revisit this.
All right, I'll make sure I take an afternoon off to be in class. Okay. Thank you so much.
Okay, if there are not further questions, then I would welcome a motion for approval.
I'm happy to make that motion.
And I'll second the motion.
Okay, and let's look again if we might have unanimity before we go to a roll call. So all those in favor of approval, say aye.
Aye.
It is unanimous. The roll call is 5-0. Okay, so with that, we can move on to a discussion of future agenda items. And does anybody have something that they want to talk about? Or Carrie?
I just wanted to remind everybody that Redwood is having a fundraiser next Thursday, the 16th, from 5 to 7. And I'm just encouraging everybody to go. As you know, most of our other schools have really well-established fundraising, and Redwood is newer at it. They have a reconstituted foundation, and they're doing fantastic. The president is energetic and has all kinds of ideas, and it's a really strong fundraising board. And I just thought it would be nice if we all show up. You don't even have to RSVP. You can just show up, and there'll be tours of the school, tours of the garden. So it's a nice opportunity to see what's going on there, and a nice opportunity to thank the people that are trying to raise a lot of money for that school.
Excellent. Okay. Now I continue to look forward to making some rounds of football season. I did have a great time at Woodside for their home opener. And I was able to see their marching band in action with their band masks. So that was one of the first schools to get hold of those. They're very clever. They're basically a double mask. So the mask we know and love with a slit for the mouth, and then another mask that comes and hangs over it. So you can get your instrument up to your mouth and then cover the whole mouthpiece area. And all of their, the bells of all their instruments have masks on them as well. So you've got a kind of a soft mute out there. So they're able to be somewhat socially distanced, masked at every end that produces airflow and participate. The crowd was excellent, large, excited crowd. There was good masking and some effort at social distancing in the crowd. But of course, it was also all outdoors. And it certainly compared pretty favorably to some of the college football I've seen on television in the last couple of weeks. And I'm looking forward to, I think I'll be at Sequoia this coming Friday, visit their game and get around a bit. And also there is activity coming up in the Safe Routes to School group for Redwood City Together has been doing an audit, particularly of traffic right along James here, and found it to be a dangerous area. And as we, I think we shared some email that a student was struck in the intersection at the far corner of Sequoia, and I believe did not suffer serious injuries, but it was a reminder of dangerous intersections that are out there. They are putting together a lot of energy and support from the city in their Safe Routes to School work. And they're going to be having a meeting coming up, I believe it's next week. Yeah, at 10 o'clock on next Wednesday. There'll be a meeting, and I'll share, I think I might have shared the details with the superintendent already. So I'll be part of that, but I hope we can have staff participation in their work going on. It's a good partnership opportunity to get benefits to all of our students' safety. And there's active work going on there also in support of Samtrans bus routes to school that are going to affect not only student safety, but community impact and environmental impact at all of our schools. So that's I think a good working partnership that we want to support very strongly. That's it for me. Shanice.
I want to let you all know I went to the 2 open houses. I went to the Green Street open house. I thought it was pretty good to go to the site where it has some of our individuals who are receiving special education services, and they just did a fabulous job of presenting, and got to reconnect with some folks I knew from the community and a couple of parents there, and it was really special, quite small and quaint, but very powerful. So I wanted to share that. And then Sequoia's open house, and they had an intro video. I didn't go to every parent room, but I went to the open house the first 15, 20 minutes, and that was really good. And then I just want to wish all of us a Latin Heritage Month. That's what it is in September. And so just want to mention that. Thank you.
Okay. So not seeing other comments, I would welcome a motion for adjournment.
So moved.
Second. Okay, All those in favor, let's see if we can make it unanimous. Ah, it was. No roll call necessary. Okay, thank you.
Thanks everybody for coming. Bye.